So I'll call the meeting of the Government Oversight Committee to order. Welcome this morning back at the State House for the first in-person meeting of the Government Oversight Committee in quite some time. It's nice to see you all here, and it's nice to be joined by folks online who had some scheduling conflicts and couldn't be here in person. So this is a hybrid in-person meeting of the Government Oversight Committee. While occurring in person, this meeting is also being broadcast live and recorded on the Government Oversight Committee's YouTube channel. The audio stream is also broadcast on the legislature's website. Just a few reminders before we get started. The legislature's audio stream is turned on at the start of the meeting. The YouTube stream is turned on at the beginning of the meeting, and I believe it's running now. If you are on Zoom, please remember to have your camera and microphone on when you're present, participating in the meeting, and have your mic off when you are not speaking. Written materials for this meeting have been mailed or distributed electronically to committee members and have been posted on the OPEGA website at the start of the meeting under GOC meetings section. During the meeting, the OPEGA director and assigned staff may share documents on the screen. I'm not sure if we have that capability today. No, we don't. Okay. During the meeting, either one of the co-chairs will recognize committee members, staff, or others to participate. For folks who are attending electronically, you can get the attention of the chairs by either raising your hand physically, raising your hand on Zoom, or calling our attention some other way, and staff are monitoring the Zoom for us. So with that out of the way, I think we will continue with introductions of committee members, and I'll begin on my right with Senator Timberlake.
Me and this mic for 4 years fought, so we're still fighting today. Thank you, Mr. Chair. I am Senator Jeff Timberlake. I represent Senate District 22 in parts of Androscoggin and Kennebec County. Thank you.
Good morning, everyone, and Senator Libby. I'm Susan DeChambeau. I represent District 32, which is my hometown of Biddeford, and I gotta name the other 5: Dayton, Lyman, Arundel, Alfred, and Kennebunkport. Thank you.
Good morning, everyone. My name is Donna Bailey. I represent Senate District 31, which is Saco, Old Orchard Beach, Hollis, Leamington, and part of Buxton.
Good morning. My name is Holly Stover, and I represent House District 89, including the towns of Boothbay Harbor, Southport, Edgecombe, Westport Island, and part of South Bristol.
Good morning, everyone. Sowen Millet, House District 71, including the citizens of Norway, Sweden, Waterford, and West Paris.
Good morning, everyone. My name is Mark Blyer. I represent District 22, which is Leamington and part of Buxton, Standish, and Limerick.
Good morning. I'm Representative Genevieve McDonald. I represent the offshore islands of Penobscot Bay and Western Frenchman's Bay. I'm the House Chair of Government Oversight. I'm joined today by my 3-year-old daughter, Evelina McDonald.
Senator Khan.
Good morning, everyone. My name is Lisa Keim. Sorry to be joining you in this format, but I'm glad to be with you. I represent Senate District 18, which is Northern Oxford County.
Thank you. And Senator Bennett. Looks like Senator Bennett is not available at this moment. We're also joined by OPEGA staff. To my right is Lucia Nixon, Director of OPEGA, and Etta Connors on my left, who is our clerk for this morning. So again, welcome everyone to this meeting. Our printed agenda, we are going to adjust the order just a bit. We will begin by hearing from Dr. Landry, Director of the Office of Child and Family Services, followed by Lisa Marquesi, and you'll tell me if I've mispronounced your last name. Lisa is the Deputy Attorney General, Chief of the Criminal Division for the Office of Attorney General. Then we'll be joined by Christine Alberry, Executive Director, Child Welfare Services, Ombudsman. And then following those presentations with questions and answer sessions for each, we have received, the Government Oversight Committee has received correspondence from two members of the legislature asking us to take some action with respect to the issues we'll be discussing today. We'll hear first from Senator Curry, Senator Chip Curry, the Senator from Waldo, and Senator from Cumberland, Senator Bill Diamond. Following those presentations, the committee will have some discussion on what steps we'd like to take next. And I'd note for the committee that today's meeting is the beginning of a process. We've gone through a long process of evaluating the Office of Child and Family Services, and in the last few years, we were prepared to engage in some follow-up work, surveying frontline workers. However, the events of May and June have caused us to come together, consider our next steps, perhaps make adjustments to how we'd like to proceed in light of 4 children who have died in Maine, several of which at the hands of their caretakers or otherwise cases of gross neglect. Some of these cases have had involvement of DHHS and OCFS, as we've been able to gather from media reports. So just if I'm totally honest, more often than not, I look forward to coming up to the legislature to do our work. And today is not necessarily one of those days because of the tragic circumstances that are before us and have caused us to come together and talk to some of the parties involved in child protective services across the state. So with that, I think unless there are any questions or comments from committee members, we'll ask our Senator Timberlake.
And I just would like to just announce now that at 11 o'clock, I have to go meet to have a conversation about the budget bill that's coming up on Monday. And it's not because I don't have great interest. And I think you did a great job of explaining the dire circumstances we're under here. And I want everybody to know that that I follow with you, but I don't want to disrupt anybody as they're speaking. So if you see me leave, it's not because I don't care, because I really do. It's very concerning to me.
Certainly appreciate that, Senator Timberlake, and you did notify me of that before we started. If members do need to leave, we understand it's not for lack of interest, but because of competing priorities. Representative Stover.
Would it be okay, Senator, if I moved over? Representative Neal isn't here, and it just would be easier to see.
Certainly, there is a line of sight issue for that one spot, Representative. So yes, that's fine. If no other questions, we'll welcome Dr. Landry from the Office of Child and Family Services up to the table in the front here, and we'd welcome remarks from you at this time, Dr. Landry. Thank you for joining us. For folks listening in, sometimes we have audio visual challenges with the equipment. If you give us just a moment, we'll get started as soon as we can. They're so sensitive. People have this problem.
Thank you. My apologies for the technical challenges there. Good morning, Senator Libby, Representative McDonald, and honorable members of the Government Oversight Committee. I'm Todd Landry. I'm the Director of the Office of Child and Family Services within the Department of Health and Human Services. The death of a child is a tragic loss for that child's future, their family, their community, and our state. It is our responsibility as a state and as a society to do all we can to help children grow up safe and ensure that they have the love and attention that they need. As Commissioner Lambrou has stated, this is a call to action, and action is being taken without delay. I'll be sharing information with you today in today's presentation about the work we have and will be doing to improve our practices. Due to confidentiality laws and to avoid compromising ongoing law enforcement investigations, I cannot speak to specific cases. That said, the department, including the commissioner, myself, and all those who work within and with OCFS, are committed to in-depth reviews of these fatalities and the use of that work to inform continued improvements to protect Maine children. As we have announced, OCFS is partnering with Casey Family Programs to gain the outside perspective of national experts in the field. We have also begun conducting our own in-depth review of any information we have related to these children and their families. This work is also being conducted in the context of the unprecedented COVID-19 pandemic, a factor that has challenged everyone and all systems in our state and in our country. As an organization and as individuals, we care deeply about child safety and well-being and are working to do all we can to learn from and improve our approach to child welfare based on the circumstances that resulted in these child fatalities and our longer-term improvements. I also want to mention our staff, including our frontline caseworkers and supervisors who have been directly impacted. We recognize the unique challenges presented by the work they do and the grief and concern we share with families and their communities. We have worked to offer support to the frontline staff impacted by these tragedies, including meeting with staff in impacted offices and ensuring that supports, including clinical supports, are available to our frontline staff at all times while they do this difficult work. As Director Nixon requested, I'll keep this total presentation to 15 minutes or less. Additional background has been provided to you separately, which I'm happy to discuss with you in this meeting or in the future. As I mentioned, the department has asked Casey Family Programs, a national leader in improving child safety and the well-being of children, to assist the department in its investigation of these deaths, to evaluate existing child safety policies in the context of these deaths, and to offer interim policy recommendations that could be implemented by the state of Maine immediately to support child and family safety. We have given Casey no limitations in what recommendations they can make or what aspects of the system to review. We want to know what policy and practice recommendations Casey will make as swiftly as possible so we can begin to act on them. Many months or a year is too long. We share Casey's value on supporting child safety within their families whenever possible, as we recognize the trauma that can result from a child's removal from their family. While there are cases where removal is necessary and in the best interest of the child, we want to avoid as many unnecessary removals as possible. We have targeted approximately 90 days for this work to be completed. And while this timeframe is an ambitious one, we believe it's both attainable and necessary. Additional details of the 90-day timeline is shown in the chart in your packet. The project timeline includes specific action steps as part of the process with Casey and their partners. It begins with document review, includes specific facilitated debriefings, as well as a systemic review of conditions. The end result of the process is a final report or reports, which will include recommendations from the lens of the cases reviewed. DHHS has committed that these recommendations will be shared publicly while also protecting the confidentiality of the individual cases. Recommendations could include policy, practice, training, and other areas that impact child protection and the larger child well-being systems. Stakeholder and staff engagement is part of the process with Casey Family Programs. As we announced publicly, DHHS invited the Child's Welfare Ombudsman to participate in this process with Casey Family Programs, and we appreciate that she has accepted that invitation. Staff involvement with the process is also key, and we have already informed staff that some of them will be invited to participate in the process. At the same time, we're leveraging our relationship with other components of the larger child well-being systems to support children and families in the state. As one example, this includes recent guidance from the OCFS medical director to pediatricians in the state and other medical professionals. The training of staff and the policies and procedures that support the decisions they make are fundamental to ensuring child safety. OCFS benefits from a child welfare workforce that cares deeply about children and families. They have devoted their careers to ensuring child safety and work diligently to provide the best services possible. Our staff have told us that it takes 1 to 2 years for a new caseworker to feel proficient at their job. Similarly, it takes time for supervisors to learn their new role after being hired or promoted. So one of the recommendations of the 2019 system-wide assessment that was conducted with staff, stakeholders, family, and youth was to review and update policies, procedures, and training to aid staff. Through a cooperative agreement with the USM Muskie School, new and revised trainings for staff and resource parents have been implemented. Several policies and procedures have also been updated, with more in process. Additional details of the specific policies are included in the supplemental memo that has been shared with you. The work with Casey gives us an opportunity to benefit from their national perspective and expertise to inform and further improve on the ongoing work with Muskie. As some of you have noted in prior discussions, the Public Child Welfare Agency is a large piece of the social safety net for children and families, and we recognize that our work is not done in a vacuum. Other factors, such as domestic violence, substance use, poverty, mental and behavioral health, and more, all impact child safety. And despite the progress made in turning the tide on the pandemic, evidence from Maine and across the country continues to suggest that people are experiencing heightened mental health and substance use issues, including parents and children. So among the actions already taken, the department has extended and broadened its Strengthen Me campaign, which offers free stress management and resiliency resources to anyone in Maine experiencing stress reactions to the pandemic. The department is also continuing and expanding the overdose prevention through intensive outreach, naloxone and safety, or options, initiative with a particular focus on the opioid crisis. The pandemic has also challenged, but it has not slowed our progress to implement the Family First Prevention Services Act in Maine, which will allow DHHS to draw federal funding to support evidence-based prevention services intended to keep children safe while preventing the need for them to enter state custody. Maine was the first state in New England to submit its state plan to the federal government, and we are on track to implement in October. As I've noted to this committee before, this work will add valuable tools to our toolbox for protecting children in Maine and supporting families to facilitate safe homes, including an infusion of approximately $2.4 million annually for prevention services. As Commissioner Lambrou has stated, Every child in Maine deserves to have the opportunity to grow up healthy, to get a good education, and to live a productive, happy, and meaningful life. With the expert assistance of Casey Family Programs, we will learn all we can from these recent deaths and continue our work so that we can reach our North Star, where all Maine children and families are safe, stable, happy, and healthy. For additional information, I refer the committee to the materials we have shared, including important information on data related to the child welfare system, as well as updates on major initiatives and more details on the implementation of the Family First Prevention Services Act. Thank you for your attention, and I'm happy to take questions that you may have.
Thank you, Dr. Landry, for your presentation. Are there questions or comments from the committee for Dr. Landry? Senator Bailey.
Thank you, Mr. Chair, and thank you for being here, Dr. Landry. I just wanted to know a little bit more about the requested report from Casey Family Programs. And is this type of request something that they've done before? And if so, where and when?
Thank you for that question. Casey Family Programs works across the nation. I believe they work in all 50 states as well as in the territories. They are the largest, one of the largest operating foundations in the country, and I'm confident they're the largest child welfare or operating foundation focused on child welfare. This is among the service that they provide. They have done this in other states. I will be happy to get you after this meeting a specific list of those states within the past few years where they have done this or similar kinds of reviews. But yes, they have done this work in other states. And that is one of the many reasons that we engaged with Casey to do this work.
Thank you. A follow-up.
Please.
And is it possible that you can also share with us your request to them for this report? I'm assuming you put something in writing to them, and I would like to see that.
We're happy to provide that to you. We did sign our agreement with Casey late last week. And so that agreement in the form of a letter of agreement between DHHS and Casey is something that we're happy to provide to you.
Thank you. I do have some more questions, but I'll defer.
Certainly. Representative Stover.
Thank you. Welcome, Dr. Landry. Nice to see you today. I know that you've provided us with a number of documents with quantitative data, which is great. And some of the areas that OPEGA has looked at in the past have been specific to caseload size and supervision and training, and also timeliness of assessments, particularly comprehensive assessments for the family. And then once that reunification, if the reunification takes place, what are those follow-up follow-up assessments for risk? So I'm just wondering if you could speak to some of the concerns that OPEGA has had in the past around caseload size, supervision training, and then also around comprehensive risk assessment, and what currently is happening and what with Casey Family Services you envision happening. Thank you.
Certainly. And thank you for that question. I'll start from the first question you asked, which is around caseload and workload. As you may know, in accordance with Maine state statutes since 2020, we have provided a workload an analytic tool and report to the legislature every January. The first one, I believe, was in October of 2019, and then in January of every subsequent year. And so that report has detailed the analytic tool that was developed in partnership and in consultation with PCG at that time. And we continue to use that analytic tool to help inform caseload and workload analytic components. I will point out in the supplemental information that we shared, we did share with you the recap of the number of new caseworkers, supervisor, and case aid positions that have been added. We're also shared in your report. One of the things I think we can point to with with pride, if you will, is the fact that we have been able to significantly reduce caseworker turnover. I believe the high was 23% in 2018, and that has reduced in 2020 down to approximately 15%. We've also given you some comparative data on caseworker turnover numbers based on national data and research from either 2003 or I believe in 2019. So that information is there from a caseload and workload perspective. And we'll have another report on where we stand with workload assessment. From a simple mathematics perspective of caseload, and one of the things that my staff is, I share with my staff is the fact that no two cases are identical, no two cases are the same. And so a caseload size of 10 for one caseworker may be very different from a caseload size of a different 10 cases for a different worker. And that is one of the reasons why we've tended to focus more on workload, because it takes into the factors of those different types of cases. But we can also provide you with caseload size information if you wish. I believe our total average caseload size, and I'm working from memory here, but from a pure mathematics perspective, right now for assessment, I believe it's approximately 9.4 on a statewide average basis. From a permanency basis, I believe that casework size or caseload size, excuse me, is approximately 12. But I again will get you those exact numbers as of this past month. So it's a bit of a question as it relates to our staff. As I said, I'm pleased with the reduction in, or the increase in retention and the reduction in turnover since 2018. And that has been a positive aspect, I believe, of much of the work that has been done, including support from this legislative body and the administration. So I believe that was one part of your question. I think the second part of your question was around assessments and the tools used for assessments. One of the pieces that we have worked with Muskie on, well, let me take a step back if I may for a moment. One of the pieces we have worked with Casey on is revising and updating new caseworker training, what we call our foundations course. That foundations course has been revised with Muskie's assistance, and that has been implemented. And now Muskie co-leads and co-teaches all of those foundations trainings for new caseworkers. They also have helped us to and are continuing to work on the supervisory academy training. The supervisory academy training is also provided to all of our supervisors, and they are also working with us on that component as well. From the perspective of assessment, that is one of the key pieces, and I think we all agree that is one of the essential key pieces at intake and assessment. Our 2019 report that I believe is on our website and has been shared with this committee previously details some of the activities related to assessment. We have worked with national entities. Evident Change is the one that we're currently working with as it relates to the implementation of the SDM tools for staff. I do want to stress that SDM as a tool is only that. It is a tool. It does not take the place of assessment or evaluation of the assessment and decision making, but it is a tool that enables and helps staff to make better decisions as it relates to those assessment components. So assessment continues to be a primary focus of ours. We have implemented the SDM tool. We've also implemented the SDM tool in other areas, including permanency. And as it relates to permanency, there's some significant information in your packet about that. One last point that I would make that's also in your packet on the supplemental memo that we provided is the aspect of success in permanency. And so you see our data, that's a federally required measure for every state in the country to monitor success in permanency. That success in permanency currently is at 87% of success in permanency, which is the highest number I believe it's been in the past 12 months.
One follow-up. Could you just, thank you for that. Could you just describe for me during a case, and if you're looking towards permanency, particularly reunification, could you just give me a sense of what the sort of the nexus points are of reassessment of risk from early reunification through a placement? returning to the home, just that reassessment of risk and what that would look like for a child returning back to their home.
Yes, and thank you for that. And so the assessment of risk happens throughout the life of a case, and it could be different for each case depending upon the different circumstances that come up with that case. As all of you I know are aware, is that once a child comes into custody, and even the process of a child coming into custody is not a unilateral decision, nor is reunification a unilateral decision by OCFS. It is part of the court process, and the court process, including guardians ad litem, parents, attorneys, and others are all involved in that ultimate decision. So the assessment component goes along with the life of a court case. And so during that court case, assessment for safety can be looked at any point again, but in general, it will be always looked at, for example, or almost always looked at before decisions are made about a trial home placement, before a decision is made about reunification, and certainly during the life of the case, whenever there are significant issues that arise as well, in addition to the assessment that's done at the beginning of the case. And so the safety assessment process is one that does not have only certain fixed time points when it occurs, because every case is different and may be needed on a more frequent or less frequent basis.
Thank you, Representative. Further questions or comments for Dr. Landry? Senator Bailey.
Thank you, Mr. Chair. So your comments, Dr. Landry, about it not being a unilateral decision, that there's many people involved in a case, leads me to ask about the stakeholders that you're inviting to participate in this review and this report. And at least according to your chart and your testimony, the only stakeholders I see involved are kind of internal people, and that you aren't including, for example, parents, attorneys, or guardians ad litem, or even judges, or anyone from the court process system. And I just wondered, first of all, who decides who the stakeholders are who are going to be invited? And if it was your department or someone under your control, how you came up with that list, if you will.
Well, and thank you for that question, because I certainly did not intend that chart to indicate that those are the only stakeholders that will be involved. In our discussions with Casey, at a minimum, those are the stakeholders that they identified from the beginning. Based on their document review of each of the cases, as we go through that flow chart that is in your packet, Casey and their partners will decide which other stakeholders are important to invite into the facilitated reviews and discussions, as well as the systemic review that will be done as part of the process as well. So Casey ultimately will decide who else to invite. They have already told us that they certainly want staff who are involved in this to be part of the process. We asked for the Child Welfare Ombudsman to be invited. Casey readily agreed to that. Everyone else is up to, and we leave that to the discretion of Casey. So they will make the invitations, and we will facilitate those invitations to whomever they choose to invite into that process based on their review of the cases. And so if I did not certainly, and so thank you for clarifying this point, certainly did not intend for that to show as a final list of those that would be invited. The process will dictate through Casey's process exactly who else is going to be invited, because each case is different. And so the individuals that may be invited are going to probably depend, I believe will depend on the circumstances related to those individual cases.
Thank you, Senator Bailey. Just as follow-up, Dr. Landry, OPECA staff over 2.5 years have developed quite a bit of expertise in this field and have had access to a lot of information that the public may not necessarily have access to. including this committee. With that said, could OPEGA be involved at certain stages of this process with Casey Family Foundations, and would you help facilitate that?
We'd be happy to help facilitate that, and we'll make sure that Casey knows that that OPEGA hopefully is interested and willing to participate and may be a valuable resource in some or all of the reviews.
Thank you.
You're welcome.
Representative Stover.
I had one follow-up question to my question earlier. It's sort of a continuation. Can you describe who has the final decision whether to return a child to a family? Is that done by the worker, the supervisor, in a team setting?
The ultimate reunification decision for a child in custody lies with the court. The recommendation regarding that reunification is a decision that's made by the caseworker supervisor, and in many situations, others within the Office of Child and Family Services and within the district. But that is a recommendation for reunification or for any other permanency outcome, I should point out. Ultimately, for a child in custody, that decision lies with the court and involves the input and recommendations of others that are part of that court process, including those individuals we mentioned before.
Could I ask a follow-up? Just as follow-up, when returning a child to the home, how often, anecdotally, I know you don't have hard data, but how often does a judge overrule the department's recommendation to return that child?
I don't have any of that data offhand. I can see if we can try to capture that data. I don't think it's data that we routinely keep in an easy to obtain metric format. Would probably involve individual case review for us to get that exact number. I will tell you it is something most of the time a permanency decision is agreed to by all of the parties. And so most of the time that decision is ultimately agreed to by everyone, including, the guardians ad litem, including the parents' attorneys, et cetera. But there are times when there are differences. I think it's a minority of cases when there is a difference of opinion. And there are certainly a number of times I can think of offhand, at least, dozens, a dozen or more times in the past year where I'm aware of the fact that we made a recommendation and the judge either in chambers or publicly on record has stated that they are in disagreement and are going to proceed with a different recommendation. Now, I hope you'll keep in mind when I say it may be, I may remember 10 or so of those in the past year. That is out of, hundreds of cases. And so, again, I do believe in the vast majority of situations and cases, all of the parties agree on the ultimate reunification decision. But there are some when there are differences of opinion.
And just to follow up on that, generally, does the department have a process, or how often would the department formally appeal a judge's decision in that case?
We do have a process. That's where we work very closely with the Assistant Attorney General. They, of course, are part of every single case in representing the department. And so we always engage with them. So if a decision is made that we think is contrary to the best interest of the child, then we will consult with the Assistant Attorney General and their system in order to make a decision as to whether or not to appeal. So that's not a decision made solely by OCFS. It's done in conjunction with the Attorney General's office.
Thank you.
Welcome.
Thank you. Senator Keim, I apologize. I didn't see your virtual hand raised, but please go ahead.
Thank you. Can everyone hear me okay?
Yes.
Okay, great. Thank you for being here today, Dr. Landry. And I just wanted to comment first on the caseworker turnover. I did notice that the levels now have gone back to what they were in 2016, and it's a great improvement over the turnover that was in 2018. And I think that's a really important metric because, essentially everything rests on having good caseworkers, and child safety does. One of the things I find concerning about today is the emphasis on the Casey family programs, that somehow this is going to be the answer to the problems and to the deaths. And we had, pretty substantial overview of our child welfare system after the deaths of Marissa Kennedy and Kendall Chick. And we have an ombudsman, and I was wondering if you had a chance to read what she provided for the committee for today's hearing.
I'm sorry, I was not provided a copy of that information so far.
Okay, yeah. So one of the things I find concerning is that there has already been highlighted issues that according to the ombudsman we haven't made progress on. And yet you're saying, we're going to have this 90-day turnaround in responding to what the Casey family programs will come up with for suggestions and changes. And yet really some of the underlying issues that I think are very problematic still have not yet been addressed, according to the ombudsman. And I'm wondering, what do you think is going to be really unusually different or unusually helpful about having yet another review of our system, as opposed to just making the changes that have already been recommended?
Well, thank you, Senator, for your question. I regret, like, as I said, I have not seen what the ombudsman has provided for you today, so I can't speak to that, but so I'll speak in general terms. Since I came into this role, have met almost or most months. We have a standing meeting, and with the exception of sometimes schedule challenges, we generally stick to that and meet with the ombudsman on that regular basis. I read every single report that she provides to the Office of Child and Family Services, as well as, of course, her annual report and interim reports that she provides as well. I believe there are many areas where we agree with the Child Welfare Ombudsman. Everyone, I believe, agrees and appreciates the fact that our improvement efforts are a continuous process. And that improvement effort means that it continually develops and continues to move forward. I do believe that we have made certain improvements, and many of those I think we've detailed for this committee before. I also absolutely agree that more is still needed and more is still necessary. One of the things that I pointed out, I believe, in my spoken testimony to you, is that it takes, according to our staff, it takes a year to 2 years for them to feel proficient, in their role. With the new caseworker positions that have been added to the department, that is a very positive thing. At the same time, that has, by mathematics alone, reduced the average tenure of our staff. And so we continue to work to improve, and I believe the proficiency of our staff is improving, and that includes in all aspects of the system. I will say that there are many cases where I've read of the ombudsman's reports where there is agreement on the case, or there's agreement on the review of the cases that she's looked at. There are some cases where it's different. Sometimes the outcome, the ultimate decision is agreed upon, but the process has points that the ombudsman has pointed out that may need improvement or looking at further. So it is a continuous process of improvement, one that we continue to engage with the ombudsman on, and we certainly look forward to her role with us with Casey. To the second part of your question of what makes this different and what we're looking to achieve here is the aspect of Casey Family Programs, who has done this work and worked in this field for 60+ years on a national basis. I believe what they can bring to the table, and one thing that we're looking forward to them bringing to the table, is that national perspective of looking at what are the national current best practices, what has been tried in other states and either worked or didn't work, and how those pieces can be helped to inform our continuous improvement efforts, either to modify them, to change the order in which they're being done, or any of those components. I think the other piece that Casey will bring to the table is that larger perspective of child well-being. And as I indicated in my testimony, many of our children, many of our families are struggling with many of the societal challenges that we know that some of our families and fellow Mainers struggle with, whether that be substance use, domestic violence, or other challenges. So I anticipate that part of the benefit of having Casey doing this review is for them to look at that larger system-wide work as well. They'll do it through the lens of these cases, but I think they'll also look at other things that we may need to do as a larger system, whether that be within DHHS or outside of DHHS, to further help improve child safety. So I do believe that there's some very critical and important value-added components of what Casey will bring to this process, and we look forward to their recommendations and implementing them.
Thank you for that. And yeah, I think what the letter from the ombudsman really just kind of touched on some highlights from the report, her most recent annual report. So there isn't really new information there, just so you're aware. But one of the things she mentions is that there's fundamental practice issues that occur again and again. And one of them is failure to complete consistent casework practice. And this, despite that there is the new training going on with the Muskie School. What would your response be to that?
And I'm sorry to ask you to do this, but could you restate the question just so I can make sure I'm doing my best to answer?
Sure, absolutely. So in her letter to us, she just the ombudsman mentions that there's fundamental practice issues that occur again and again. And one of them she mentions is the department continues to fail to complete consistent casework practice during the moments in cases where the determination of child safety is most consequential. And I was wondering what your response would be to that.
I would say that casework practice and supervisor practice are, essential to any well-functioning system, as it would be for any system that we might be talking about. I do believe that over time, as a caseworker and as a supervisor has more tenure, experience, and training in their roles, in general, I believe that you see that practice continues to improve. I believe in total for the system that, generally speaking, I believe our practice is improving. Is it improving fast enough for that any of us would wish it to be? I would say no. We always want that improvement to happen immediately, of course, but that improvement does take some time. It involves consistent caseworker and caseworker supervisor review of cases, learning from those and adapting their practice and improving their practice as they go forward. So I do believe it's a continuously improving goal that we have for casework practice and supervisor practice. I understand and respect the opinion of the ombudsman that in the selected cases that she is reviewing, that she is not seeing enough of that practice improvement. At a total system level, I do see more of that system improvement than she may be seeing in the individual cases that she's looking at. But we are in absolute agreement that further improvement is necessary. And part of what I believe Casey is going to assist us with is identifying any specific components of that practice that we need to specifically focus on through the lens of these cases as further improvement efforts.
One of the recommendations in the letter is that frontline staff need to have their voices heard and their opinions taken into account in all areas. And when she mentions the frontline staff there, is that caseworkers, or can you tell me who that is exactly?
I believe what I can't speak for her, of course, but I believe what she is likely referring to are the frontline caseworkers. She may also be referring to caseworker supervisors. But I would assume my general assumption is that who she was referring to.
Mhm. So recently, and Senator Libby, if it's all right, if I just keep going, since it's more difficult for me to jump in, but I can pause and let someone else ask questions. I had just a couple more.
Sure, Senator Kime, you're welcome to proceed. I'll just note for the committee and the public that we will have the ombudsman testifying later this morning. So we can get clarity on some of those questions as well. But please,
Yes.
please go ahead.
Thank you. So one of the concerns I have is that I've had constituents reach out from my district, and specifically school teachers and school resource officers who are giving me a very dire picture of their interactions, and of feeling that the department is not responsive as much as they should be to complaints. And this was happening before the most recent deaths. And then, so one of the things when I look at the idea of frontline staff, I'm thinking probably school teachers are some of the most frequent reporters. Would that be a correct assumption?
That is a correct assumption in a given year, absent, and so 2020 with the pandemic changed these numbers slightly, but in general, school personnel, and that would include teachers and other staff, but school personnel generally account for one of the top 2 or 3 categories of individuals that make reports to the department. It generally speaking, the top 3 categories in any given typical year would be law enforcement, pediatricians or medical personnel, and school personnel.
Mm-hmm. Yeah, that's very good. Yeah, that's what I was makes sense. And thankfully they're there and have this, this close interaction with children to watch daily how well they're doing. So to hear from teachers that, so I'll give you an example, sending a text message to, which is, I guess, an acceptable form of communication around some concerning circumstances and asking there to be a home visit. The teacher then had to do follow-up 3 times in order to find out from a supervisor that that in fact eventually a month later a home visit was made. And with those types of reports coming to me from a teacher in my district, I think there's a real problem with communication, that I can see how these deaths have come about, honestly. Also, another thing I heard from the teacher is that if they communicate verbally with the child's caseworker, that may or may not be documented. And so the information from sort of many small instances of small reports of maybe something a little less concerning aren't being added to the case. So there isn't something being built up. And she was told that the only way to be certain that an incident would be added to a case file is if they fill out an intake report. But then hearing her talk to me about an intake report, it apparently takes hours and hours of waiting. Because the paperwork and waiting for someone from the department to get back to them, those are some of the issues. So it's easier to try to verbally get a hold of someone and tell them what they're seeing, so that they don't have to, in the middle of their day, devote hours to being on hold to try and get a hold of the department to fill out the intake report. Is this something that you've heard before? Is this uncommon? Does it surprise you? What's your response?
Well, I'll attempt to answer that question. You gave a few different examples, and so I'll start off first and foremost that if If you are, want to share any of the specifics about that with me, we'll make sure that we follow up on those specific instances, of course. In general, what I would tell you is that we, from an intake perspective and an intake report perspective, and we can provide you this data. We've done it before and we've shared it with the OPEGA staff. The intake call system has been dramatically improved versus 2017 and 2018. The average hold time is in seconds versus minutes. We've implemented a process where if it is going to be a hold time of more than a few minutes, they have the option of us calling them back versus them waiting on hold. And so we'll be happy to provide you with that data, but the performance from a perspective of an intake call coming in and being answered, even during the pandemic, has been, I think, very positive. Now, I believe what you may have been referring to is the desire by a teacher or school personnel to get a report back from the department on what happened with that intake report. In some cases, we may be reaching back out for them for additional clarifying information in that intake report. In other cases, they provided us everything that we need to be able to proceed and make a decision to go forward. And again, we're limited in what we at times may be able to share with them based on confidentiality, just as school teachers may be limited with their requirements on confidentiality. So depending upon the situation, I can understand the perspective that someone has shared with you on that. I can also say that I don't necessarily hear as many of the concerns that you've addressed on that topic, but would be happy again to look at it in more detail and on those individual case specific basis if you want to share that information with us.
Yes, and I will at some point in the near future set up a meeting and we'll go into those more specifically. But I did want to bring up the issues in this public forum today because I think it's important that everyone hear what I would consider to be the frontline workers as well. And that I guess I would encourage for the stakeholder group for us to be considering that these community members that are frontline workers, whether it's a school resource officer or school teachers or school staff, that I think they give us a very good perspective on how well the department's doing from their perspective. If they are continually reporting a child that they feel is neglected or abused and they don't see anything change on their end and they're in, daily interaction with that child, then I think that's an important measurement for us to be hearing on how the department's doing. And so I would hope that they're part of how you're utilizing them to assess how the department's doing. One other concern I had, which I wanted you to respond to, was that was one principal was told that they didn't have a place for the children to go. So they said, we're not removing the children because we have no place to put them. And that was a number of months back. And so I wanted to hear if that is a problem and how much of a problem that is, because we've talked about hoteling before. I think that wasn't happening during the pandemic, but I don't know if we're leaving children in places because we don't have safe alternatives.
Well, thank you for that question. We certainly should not be leaving a child in an unsafe situation because of a perception or reality of a lack of an alternative placement. What I can share with you to your question is we provided on time, I believe OPEGA will confirm, we provided 12 consecutive months of data as it relates to children, where they are placed, how many children were in a hotel situation. And I believe all of that data is available from the OPEGA staff. And we'd be happy to update that information. Fortunately, we've had a relatively small number of children that because of a lack of placement or issue at the time that had to be hotel or cared for in a hotel setting. Very small numbers, and I think Opega and the staff again will confirm that with the information that they have available for you. As it relates to, in general, placements, one of the things that I give a tremendous amount of credit to our staff, and this is again an involvement with also the team at Muskie, is despite the challenges of the pandemic, and this information is in the supplemental memo that I gave you, over the past 2 years, we've increased the number of licensed resource homes, sometimes called foster homes, by approximately 30%, despite the challenge of the pandemic. And that increase occurred in both of those years, respectively. And so with support from Muskie during that time period, we also changed and modified and improved our resource parent training and quickly pivoted that training during the pandemic to virtual versus in person, so that there was no delay or a minimum amount of delay in continuing to license those resource families. Now, that doesn't mean that we have a appropriate at the moment placement spread throughout the entire state, depending upon the need of a child. Certainly, I would be the first to say that large sibling groups, and we always, of course, try to keep those large sibling groups together, can be sometimes a challenge to find a resource home for where all of the children can be placed together, particularly if they are 4 or 5 children in that sibling group. Also, a challenge sometimes can be finding placements for older youth, teens and adolescents, particularly if they have very significant behavioral health challenges. That can be a challenge for us as well. So there are times when, even though we may have on paper a number of available resource families, because of the type of a child that they're interested or willing to foster or care for at the time, there can sometimes be a challenge, and that may result in a short-term hospital, or I'm sorry, short-term hotel stay where the child or youth is being cared for. But in general, and again, I think your Opega team can share with you all of that data. Those numbers are quite small, and I think that's something that I give a lot of credit to our staff in working on. Last thing, if I may, that I would say on that topic, one of the things that we continue to focus on is when a child has to come into care and a judge and the court decides that they are going to sign the PPO in order for the child to come into the care and custody of the state. The very first place that we hope to find a placement for them with is their own relatives or a family member who can safely care for them. We currently have approximately 43% of the children who are in our care and custody that are placed with relatives. And that, I think, is a very positive, especially when you consider the national averages, I believe, are around the mid 30 percentiles. So again, that's something that we're pleased about and proud of. The other piece that I will very quickly say is we are one of the lowest in the country in placing youth in residential settings. So non-family settings, such as a residential treatment center or something along those lines. Approximately 2.5% of our children in our care are placed in those non-family settings. That, I believe, is one of the 2 or 3 lowest percentages in the country. And that in general, I believe is a very positive thing, because we always want children to be cared for in a family setting versus in a residential or group setting wherever possible.
Yeah, thank you for that further information. And yes, the increase in foster homes is good to hear. And I think that it was mentioned before and I had forgotten, but it's good to be reminded of that, because that's really important. Yeah, so thank you for answering all those questions. I guess and I'll let someone else talk. I do think it's important that we listen to the community stakeholders and get their feedback on how the department's doing, not just from the caseworkers, but from the people who are on the other side of the caseworkers. Thank you again for being here.
You're welcome. I would also just remind, and when you're talking about that larger group of stakeholders, you may remember at the end of, in the fall of last year, the fall of last year, we conducted in an agreement with the Judiciary Committee and the HHS committees, we conducted a series of public forums. We had hundreds of people participate in those virtual forums. And the report of those findings that was compiled for us by a professor at Farmington is available. I know we provided to you before. It's also available on our website. And that included the voice of teachers and school personnel as well.
Yes,
Thank
thank you.
Representative McDonald.
Thank you, Chair. So in light of the death of multiple young children who were not in state care at that time, I have a number of questions about the risk assessment and intake process, particularly as it applies to young children. In the February 2019 OPEGA information brief, one particular paragraph stood out to me in the policy and practice changes section. And if I could read a bit to you. OPEGA heard from many interviewees that the SDM tool impacts decisions on types of abuse in ways that differ from previous practice. Those situations involve affected infants, domestic violence, and physical abuse with younger children present, and drug abuse with younger children present. Prior to SDM, we heard that reports of abuse in these situations generally would result in appropriate reports, triggering OCFS assessment. Currently, the SDM tool classifies reports in these areas as inappropriate for further action. We heard from workers that case-by-case adjustments were made because of concerns that SDM was causing the department to overlook cases where a child's safety may be at risk. This happened by way of the central office asking intake to use caution and to override SDM decisions in these types of cases. We also heard that this led to workers being less clear on the decisions that they should make. And so I was wondering if you could explain a bit if this has been addressed and how it is addressed.
Thank you for your question. The SDM process or the SDM tool is exactly that. It is a tool. And just like any tool that we have at our disposal, it is important to make sure you use the tool with discretion and with oversight. There's nothing automatic that should be associated with that tool. And that is why there's always the opportunity for that tool to be, and the recommendation, if you will, from that tool to be reviewed and overseen and perhaps changed. Just like any tool that any of us may have in a toolbox, it may not always give us it provides information, it provides data, but it does not necessarily always have the exact answer. And that's why it's important to make sure that our staff know exactly that the SDM is exactly that, a tool. And I think since 19, we've been working with staff to do that, including incremental training from the SDM developers in order to ensure that they have that feedback and further training on the appropriate use of that tool. The one way that I try to explain this to our staff is SDM, like anything, is one of many tools that hopefully we have in our toolbox. And what we need to do is make sure we're using the appropriate tools at the right time and recognizing that even in the cases of SDM, that just because it may provide a certain assessment rating or may provide a certain piece of information, it still has to be done with judgment and oversight on the part of the caseworker supervisor, and potentially others that are involved as well.
Thank you for that response. So in the event that the SDM tool does not find a need for assessment, is that reviewed by a caseworker and perhaps their supervisor?
It can be, yes. And so it goes in both, it goes in either situation. It may recommend that that next step perhaps not be taken. That can be, adjusted or overruled using your language, or the opposite can be true. So again, it is a tool that we want our staff to use because we think that tool provides a good structured way of looking at a case and at an assessment. But it is not the only thing that should be considered when making a decision.
Thank you for that answer. So it's not automatic, it's not policy that the department review it, though, that a case, say if you have a new caseworker and there is found no reason for further assessment, that wouldn't automatically be reviewed. That's optional.
It will be reviewed. It's optional whether or not it's changed.
Correct. All right, full sorry. I guess it's correct. Correct my answer, but it's not common practice, particularly for a supervisor to review it.
Oh, it's very common practice for the supervisors to
Does it
review.
have to be requested by the caseworker, or will it automatically be reviewed by someone else?
I think it depends upon the situation, the caseworker. I believe in most situations where it's a newer caseworker, then that process is automatic. If you have a more tenured caseworker, it may not be.
Thank you. And one more follow-up question. Is there criteria specific to very young children in the risk assessment process?
I believe the risk assessment process does certainly take into account the added vulnerabilities of young children versus perhaps older children. So yes.
Thank you.
Further questions or comments for Dr. Landry? Dr. Landry, I have two questions for you. After a 2+ year engagement with OPEGA and the GOC, you reported to us in April, a very thorough presentation, and it gave us the sense that things were really on the up and up, and that the condition on the ground was improving significantly. And perhaps it's a coincidence, but not long after that fact, we were made aware of 4, potentially 5 cases of children who died at the hands of their caretakers. My question is very, very simple for you. I just ask for your opinion. You know, what happened? What went wrong? How did these cases slip through the cracks?
I appreciate the question. I believe that is part of what we will continue to look at, uncover, and both with our internal review as well as with Casey's assistance to look at these cases very specifically and answer that question. To I think your larger question that you were posing, I think one of the challenges for anyone in the system and anyone in this kind of role is the fact that you're looking at a multitude of different types of inputs from a question of improvements in the system. And I take that responsibility very, very seriously. It's why I read every single one of the ombudsman reports that come back in, because that gives us a lens into certain specific selected cases. I also look at a variety of other reports, some at the system level and some at the case level. I think one of the challenges that we have is, and that is endemic in all of these situations, is you look at data and information, some of which I've provided to you at a system level that looks at, for example, federally required measures that may show directional improvement that looks very positive. At the same time, you also may hear of individual cases or other data points that show that that improvement is not necessarily being made or not being made as fast as you would like. So you have to take into account and balance all of those factors, including these individual cases, to help inform larger system-wide practice. And that's exactly what we attempt to do and what we'll continue to try to do in this case with the assistance of Casey on these individual cases.
My second question is, understanding the laws of confidentiality that you have to operate under. As a general matter, I think we are curious to learn, what is the response, what does the process look like when OCFS, starting with yourself, are notified of a child death where the child had engagement with OCFS? As a general matter, can you walk us through the steps, beginning with yourself down to intake and community partners of the department's process for responding to that information?
I'll attempt to do that, and hopefully it will answer your question. If not, please stop me and I'll try to approach it differently. Whenever there is a serious injury or fatality, I am notified, as well as others within the department are notified. And that initial report will usually contain specific information about the circumstances with which that serious injury or fatality may have occurred, to the knowledge that we have at that point. That information may initially come from a medical personnel. It may initially come from a law enforcement individual. It may initially come from a different referent. But as soon as that information comes in, then that information is shared, including with me and others within the department. Generally speaking, the next step in that process is more information needs to be found. There's generally a number of next steps as far as what happens at that point. Some of that information may be related to garnering additional information from law enforcement, getting additional information from medical personnel, or doing additional information into our own files and data and information. At some point, for certain of these cases, then there is an analysis or further analysis done regarding that case and that situation from the perspective of not only garnering more information, but also beginning the learning process of what can be learned of what may have occurred in that case, as well as how it informs potential changes that we need to make to future practice or to policies and things of that nature. Eventually, in the case of certain serious injuries and deaths, eventually once the entire, if there is a prosecution or a case that's involved, then it can at that point be reviewed by the Child Death Serious Injury Review Panel. It's one of the required panels under the federal CAPTA law. And they in turn will do a larger system review that usually occurs some months after the serious injury or the fatality, so that all of the information can be collected. And so it's done on a post aspect fact.
Is the process you've laid out captured in a policy document?
Certain components are captured in a policy document. I'm not aware that there is one document that has that entire process documented. We can certainly do that. But we do have certain policies and practices and procedures that lay out that exact process. Yes.
Thank you.
You're welcome.
Further questions or comments from the committee for Dr. Landry? Senator Bailey.
Thank you, Mr. Chair. Dr. Landry, just following up with Senator Libby's question. I didn't hear anywhere in your response some provision for accountability. So I saw where, there was analysis and there might be some recommendations for changing and learning, which is all done internally. But where's the accountability? Where does that fit in?
Well, and thank you for pointing that out. And certainly accountability is part of that process as well. And so if there is a piece of the process where something did not go according to policy or procedure, then that is certainly addressed on an individualized basis for those individuals, wherever those individuals are within the organization. But accountability is part of that. I believe there's also the aspect that we all collectively share accountability and responsibility whenever a situation like this may occur, whether it be a serious injury or a fatality. And we certainly take that seriously as well.
Seeing no further questions, Dr. Landry, thank you for joining us this morning.
You're welcome.
Next, we'd like to hear from the Office of Attorney General. So, good morning. If you could put your mic on. Thank you.
Good morning, Senator Libby, Representative McDonald, and honorable members of the Government Oversight Committee. My name is Lisa Marchese. I'm Deputy Attorney General, Chief of the Criminal Division. I'm also Chair of the Domestic Violence Homicide Review Panel, which is a statutorily mandated panel that reviews all domestic violence homicides which includes intimate partner homicide and intrafamilial homicide. And you just heard reference made to the Child Death and Serious Injury Review Panel. This one is focused on domestic violence. Representative Stover was on the panel for many years. I want to thank you for the invitation to appear before you. I hope I can be helpful to you. The Criminal Division of the Attorney General's Office in Maine prosecutes all non-motor vehicle homicide cases. Homicides in Maine are investigated by the Maine State Police, except in the cities of Bangor and Portland, and in those cities, their own police department conduct the homicide investigations. The district attorney's offices prosecute those child abuse cases which do not result in death. As you may be aware, the Attorney General's office has charged 3 people in 3 different child death cases that occurred in late May and June. In each of these cases, the police are conducting thorough investigations of the facts leading up to the death. If our office charges a person with murder or manslaughter, it is our responsibility at trial to prove beyond a reasonable doubt that the person charged is the person responsible for the death. A homicide investigation contains the investigative reports, the police reports, and those records are confidential by statute pursuant to the Intelligence and Information Records Act, which can be found in Title 16. I think it's important to understand why these records are confidential. Simply because charges are brought does not mean the investigation ends. Public dissemination of facts in any case can affect the recollection of witnesses so that witnesses' memories are impacted by what they saw or they heard in the press or on TV, as opposed to what they actually saw and heard. As a prosecutor, I also have to be mindful of defendants' rights and their ability to impanel an impartial jury. Extensive publicity can adversely impact that. Any records request also requires us to ensure that there is not an unwarranted invasion of a person's privacy. Having said all of this, there are generally affidavits filed with the court that lay out at least some of the facts in the case. Affidavits in homicide cases are generally impounded for a period of time and then released to the public. I can assist the committee with 2 affidavits in currently pending cases. One of the affidavits has not yet been released. It is likely that our criminal investigative file will not become fully available for several months. I think it's also important to note that our criminal investigative file does not contain a copy of the DHHS file. We have to get that pursuant to court order. Additionally, and I'm sure you all know this, simply because a person is charged with a crime involving a child does not necessarily mean that DHHS was involved with that family prior to the death. I want to assure you that we have no desire to interfere with the work of your committee. It is my duty to balance the needs of the criminal investigation with the needs of this committee and others to do their work. Obviously, the easiest way to do that work is at the conclusion of the criminal matter, but I certainly recognize that's at odds with your time frame and certainly Dr. Landry's time frames. Unfortunately, there's currently a backlog of homicide cases, and any of the pending cases will not be adjudicated probably for at least 18 to 24 months. In the meantime, I will provide information that I am permitted to under the law. And in 2013, the legislature did create an exception to some of the prohibitions that I previously mentioned. And it says that a government agency responsible for investigating child or adult abuse, neglect, or exploitation, or regulating facilities and programs providing care to adults or children can be subject to the reasonable limitations or exempted from the reasonable limitations. So the problem there becomes secondary dissemination, but I am certainly happy to work with DHHS, happy to work with OPEGA, but the further dissemination of information may be problematic. I want to assure you that the Homicide Review Panel, the Child Death and Serious Injury Review Panel will look at these cases at their conclusion, and I am happy to answer any questions.
Thank you, Deputy AG Marchese. Are there questions or comments from the committee at this time? Senator Bailey.
Thank you, Mr. Chair, and welcome, Ms. Marchese.
Thank you.
So from what you're saying, it sounds like your files will not be available to Casey in doing their review. Is that accurate?
I'm not sure it's 100% accurate because I can put what is called reasonable limitations upon their review of a file. You may recall that a few years back when OPEGA did their investigation into the Marissa Kennedy Kendall Chick case, we shared our files to the extent that we could. The problem then becomes a secondary sharing. In other words, making certain information become public. But I can make files available privately or confidentially to Casey, but I couldn't allow them to share the investigative files beyond their own review. Until, of course, the case is over.
Senator Shambo.
Welcome.
Thank you.
Attorney Marchese, your last sentence, if you could read that you read in your testimony, something about review of those cases. It's almost independent of the legal review. I was questioning, for what purpose would you have in going from the legal and the criminal case to then looking at it in what way and what we would look for? What purpose would you, in your capacity?
Sure, and thank you for that question. As chair of the Homicide Review Panel, we look at systems.
Okay.
So part of looking at all of the systems is looking at the case file, looking at DHHS file. Occasionally there's confidential information from the state forensic unit. And what we look at is all of the intersections of the systems to see what could have happened or what we could have done to prevent the death. And as a matter of fact, if you look in your emails from probably late April, our office sent you the 13th biennial Homicide Review Panel report, and we did a 20-year retrospective of all of the cases that we had looked at. And if anybody, I'm sure you get many emails, and if anybody needs a copy, I'm happy to deliver a paper copy to you or send you the email again. Happy to do that.
I would be interested
Sure.
because that was going to be my next question. Where would we find that information?
Sure. Well, I was told you all had a copy of in your inbox.
When
It
you
is-
say you, this committee,
The entire legislature.
okay, the entire legislature?
Yes. By statute, we're required to report to the Judiciary Committee. But traditionally, we always send it to members of the legislature. But you can also view it on the Attorney General's website.
Easy enough. Thank you.
But we'll get you some hard copies too.
Thank you, Senator. If you could resend that to this committee, that would be
Absolutely.
helpful. Senator Bailey.
Thank you, Mr. Chair. A totally different question. To your knowledge, and I know you've been at the Attorney General's office for quite some time, To your knowledge, has the Department of Health and Human Services or its predecessor or any state agency ever been charged with negligent manslaughter?
A state agency, ma'am?
Yeah.
No, not that I'm aware of.
Thank you.
Further questions or comments? Seeing none, thank you for joining us.
Thank you.
Next, we'd like to invite Christine Alberry, who's the Executive Director for the Office of Child Welfare Services Ombudsman. Welcome back, Ms. Alberry.
Thank you. Good morning, Senator Libby, Representative McDonald, and members of the Government Oversight Committee. Thank you very much for having me here today. We are here today because of recently reported child deaths have resulted in a renewed focus again on child welfare improvements and reforms. The department, as you've heard, plans to work with Casey Family Services to review 4 of the deaths, and the Ombudsman's Office has been invited to be part of that process. The Ombudsman's Office will also be independently reviewing 3 of the deaths at this point in the same manner as our normal case-specific reviews that are authorized by statute. Just a bit of background, Maine's Child Welfare Ombudsman Program is an independent nonprofit authorized within the Child Protection Statute 22 MRSA 4087-A to provide information and referrals to individuals requesting assistance with child welfare and to perform case-specific reviews of child welfare involvement. Under the statute, the Ombudsman also has a duty to analyze and provide opinions and recommendations to agencies, the governor, the legislature on state programs, rules, policies, and laws. The Ombudsman's opinions and recommendations are based on our case-specific reports. We receive a complaint from an individual who calls the Ombudsman, and then the complaint is referred to the department. We review all of the information relevant to the determination of the complaint, including a response from the department. The report is drafted. We receive feedback on the report, come to an agreement about the contents of the report, and then finalize the report. For many years, including prior to the deaths of Marissa Kennedy and Kendall Chick, the Ombudsman has been flagging serious practice issues within child welfare that can cause children who are unsafe to be missed or returned to their parents before it is safe. As you know, in our most recent annual report for fiscal year 2020, we found that the department continued to struggle with practice issues and decision-making around 2 crucial points of child welfare involvement. The first, when making the decision whether or not the child will be safe in the home during the initial investigation. And the second is when making the decision whether the child will be safe in the home once reunified with the parents. Unfortunately, the practice issues detailed in the 2020 report have not improved that we've seen so far. From October 1st, 2020 through April 30th, 2021, the Ombudsman finalized review of 43 child welfare cases. Out of the 43 cases, 17 had substantial issues, equating to about 40% of cases. These numbers are virtually identical to the first 6 months of last year, though they cover the first 7 months of this year. The department continues to fail to complete consistent casework practice during the moments in cases where the determination of child safety is the most consequential. Again, during the initial safety investigations of cases where the safety of children is not accurately determined. This includes safety plans, both in and out of home, that are not appropriate or adequately monitored. Also, once children are in state custody, during ongoing assessment of parents' progress and reunification. If the assessment is not thorough, the department reaches the end of a case without enough information to accurately decide whether or not a child will be safe if returned to a parent. This includes issues with assessment of safety of children in trial placement. Child welfare cases are complex, and progress is not easily measured and is not usually measured by numbers and percentages. The measure of progress of child welfare improvements is at the heart of the Ombudsman's disagreements with the department. It is a mistake, and this is what I worry about, that we overly rely on quantitative assessments of child welfare data in place of qualitative assessments. And now I apologize, I'm going to get into the weeds a little bit here with this, but I think it's really important for you to understand particularly if you're going to further investigate what's going on in child welfare. For example, the initial child protective investigation has a number of quantitative measures that are done for every assessment. The caseworker must make initial contact with the child within 24 or 72 hours, depending on the nature of the report. The SDM tool must be filled out in order to determine a numbered risk level that is used in decision-making. The investigation must be completed within 35 days. These numerical measures are important and provide data that is easy to collect, but do not provide any information about the quality of the investigation. The quality of the investigation determines whether decisions about child safety are accurate. Here are some examples of qualitative measures of the initial investigation. Was the interview with the out-of-home parent thorough? Were all of the police reports obtained after the department learned that the mother's boyfriend had a history of domestic violence? Did anyone knock on the neighbor's door to see if they knew anything? Did the department follow the evidence where it led? Was there enough information collected to enter into the SDM tool to have it accurately determine the level of risk? These qualitative measures are the focus of case-specific reviews of the Ombudsman. The department's own internal quality assurance department completes these types of reviews as well, consistently done in accordance with federal guidelines, and should also be given weight. The OPEGA report on the deaths of Marissa Kennedy and Kendall Chick similarly focused on the quality of the child welfare system. These differences in measurements come up in the reunification portion of the child welfare case as well. The most important example of this is the quantitative measure of how long a child is in state custody. One of the department's main focuses is the measure of timeliness to permanency. This is the basic question of how long a child has to stay in state custody until they can become reunified with their parent or adopted. The amount of time until they have a permanent home. If there is pressure to provide timely permanency without making certain that casework practices within these high-risk cases collect enough information, children will be reunified before it is safe. The qualitative measures in a reunification portion of the case might include whether or not there are meaningful face-to-face contacts with parents throughout the case, meaningful contacts with service providers, making sure that the parents have the correct services for their needs, and following information and evidence where it leads. In other words, we know that we want children to exit state custody as fast as possible, but do we have enough information to say whether or not the child will be safe if they go home? We have found that the answer to this question is not always. The Ombudsman's office has consistently recommended increased training for staff, both caseworkers and supervisors, that targets these areas of basic assessment investigation practices, both initial and ongoing. The department, as you've heard, has currently partnered with the Muskie School to provide new caseworker training and to issue updated policies. But these tasks, while important, do not effectively address the fundamental practice issues that occur again and again. And I do have some recommendations, and I wanted to also address some of the questions that had come up during the previous speakers. So one of the recommendations is that frontline staff need to have their voices heard and their opinions taken into account in all areas. And yes, to Senator Kimes' question, I was referring to caseworkers and supervisors in this particular instance. Although it is true, all stakeholders certainly have a lot of value to contribute. Everybody who's working with children who are involved with child welfare has a lot of value to contribute. And in terms of caseworkers, I think it's really important that they're, just to be a little bit more specific about this, that their voices are heard when some of these improvements and initiatives and policy changes are being made. I think that that doesn't always happen. And I think sometimes, for example, in the current policy initiatives and rewriting the policies with the Muskie School, I don't know, at least in a couple recently, that the caseworkers were involved, and I think it made a difference that they weren't. At least at the outset, they have a chance to speak to the policies after they've been drafted. Improvements in child welfare need to be laser focused on training for staff at crucial decision-making points. Staff must also have enough time to perform their work. The department should increase their inclusion of stakeholders in their planning and decision-making. Transparency should be increased and trust built. The role of the Child Welfare Ombudsman, the Serious Injury and Death Review Panel, and the main Child Welfare Advisory Panel should be strengthened. And the relationship between these three organizations should be fully collaborative, both with each other and with the department. I just wanted to briefly address, I think that I wanted to disagree to some extent that the ombudsman and the department's communication have been regular. Over the past year, my meetings with Dr. Landry and others have not been as regular as I would have liked, although that has been addressed more recently, and I think we're on to a better path now. And in general, I think the communication and collaboration has been less than I would like. Again, not just with Dr. Landry, but with others in the department. I'm always happy to offer anything that I can do to lend my expertise and assistance to any of the reforms that they're making, any plans, any thoughts in the future. I just wanted to also say briefly, it might be of interest to the committee, and I can't remember who asked the question, but so I have actually worked with Casey a little bit recently. So New Hampshire the New Hampshire Ombudsman's Office has been working with Casey for several years now, doing case-specific reviews. They have a really great process, and I haven't been involved in the agreement with Casey to figure out what exactly we're doing. So I'm not sure if this is what we're doing, but they have been involved with the New Hampshire Ombudsman's Office. And back in 2019, I think it was, we actually did a cross-border review with them. They also have a lot of expertise. I saw them also, again, put on by the New Hampshire Ombudsman's Office. They put on a great presentation about what to do and what not to do in the wake of highly publicized child deaths. And at the time, I remember thinking that we could have learned a lot from that in the wake of Marissa Kennedy and Kendall Chick's deaths. So they have I'm very happy that they're going to be involved, and they have a lot of expertise to contribute. And so I don't want to talk too much more. Oh, just one more thing I did want to say. I think that it's really easy when things like this happen to blame caseworkers and blame the frontline staff who are involved. In general, the things that I see in cases where things go wrong, and I'm obviously not talking about the deaths that we're here for today. When things go wrong, I've not seen it where it's because someone is acting in bad faith or doesn't care about the children. Caseworkers worry about the children on their caseloads all the time. And generally speaking, when something like this happens, it just makes their jobs even harder because they get a lot of pushback from people who are angry, and understandably so, about what they're seeing in the news. So I just want to take a moment to say that I think that supporting the caseworkers is one of the most important things we can all do going forward. And a lot of them are out there doing really good work. Okay, I'm happy to answer any questions.
Thank you, Ms. Alberry. Questions or comments from the committee? Senator Bailey.
Thank you, Mr. Chair, and thank you. So one thing you mentioned that I wanted to just follow up is one of your recommendations is increasing transparency. And I know that's something I struggle with in this area because it seems to me that the child welfare system is a very closed system. And I certainly understand the need for confidentiality for protecting children. But again, what that leads to is a very closed system. And so the only people who know everything are the very people who are also looking at what needs to be done. And it's just a circular system. And so what are your thoughts, and do you have any specific recommendations on how we can increase transparency? Because again, in this area, the courtroom is closed, the case files are closed. I mean, everything is closed. There's no one from the public or the outside looking in on this system at any time. And that to me is a problem that we need to try to find a solution. And I would love to have your thoughts on that.
Sure. So I think that the easier answer to your question is to increase transparency, not in terms of the actual facts of the cases that are involved, but to increase at all levels of decision-making within the department, transparency on how the decisions are made, who is making the decisions, which stakeholders. And I know we talk about stakeholders, but it's extremely important to have people with a variety of different types of expertise involved in making decisions, whether, I mean, I mentioned caseworkers before, but someone who is an expert in family or in domestic violence, for example, to make sure that all of the new policies have domestic violence informed. If there is some kind of a new initiative that's happening, that involves hospital nurses, make sure that the hospital nurses say, you know what, this is possible, this is a good idea, or, I don't know about this, basically just making sure that the lines of communication are open, because there is so much that we can communicate about that does not have to do with confidential details of child welfare cases. And then the other part of it is, there are a number of reasons, and good ones too, why the laws surrounding confidentiality of child welfare cases exist and why they're probably not going to be changed anytime soon. But there are statutory bodies in Maine, myself and the Serious Injury and Death Review Panel and OPEGA, who all can get access to that information. And I think that we can share, I think that all of us can, share that information as much as possible, again, without revealing confidential details. But that way, the legislature and the public knows that, with the department, the ombudsman, Serious Injury and Death Review Panel, OPEGA, and I can't think of anyone else who is actually entitled to that information that could do those kinds of reports, but, maybe there is or could be, that at least we know there are that many people looking at a situation. If we say, X, Y, and Z need to happen because we looked at this confidential information, then, I think it would at least make some people feel a little bit better that we're operating, based on facts and what's actually going on the ground. I don't know if that answered your question.
Further questions or comments? Senator Keim has her hand up.
Thank you. Thank you for being here, Ms. Elberry. Yeah, I have a couple of questions for you, and one kind of circling back to my comments around school teachers or school personnel. Is there any type of feedback loop or assessment on caseworkers that you're aware of where they are connecting back both with families that they work with and other stakeholders within the community to assess how they're doing the thoroughness, basically, of their job?
So I think, and I think I understand your question. So there are a couple things. If a teacher, for example, calls and makes a report to Child Protective Intake, part of, if that results in an assessment, and this is not maybe what you were talking about with your specific examples, but anyone who makes a report to Child Protective, and it results in an assessment, the caseworker is supposed to contact the person who actually made the report and follow up with them and make sure that there isn't any additional information. So that's one piece of it. Now, that doesn't happen if it's a report that's made that is not marked as appropriate for assessment. It is very difficult for caseworkers sometimes to get in touch with people who call and give them information, because they can't always say what they're doing or say what's happening. But that's, I think, a different thing than what you were talking about, where the teachers were concerned and they just wanted somebody to check on the child. So there isn't aside from that formalized part of policy where the person who contacts intake has to be contacted at the beginning of an assessment. There's I'm not aware of any formalized way that happens, but it does happen. And I guess another place is if if a service case or a court case is opened and there's a family team meeting, sometimes some of those providers are invited to the family team meeting to help plan. I find that just in general, cases go a lot better when there's open communication, particularly with the schools. The schools are sometimes the last to know about safety plans or changes in custody. And schools do have a lot of really valuable information about kids.
Yes, yeah, you're touching on, some of what I heard, which is now that, so one particular school I was chatting with, now that they have a school resource officer who works in their local police department, they said that their ability to work together and coordinate efforts has really changed outcomes for kids. And it makes me consider that possibly these two stakeholder groups are maybe siloed from the department. And so what I was trying to get at is how are we, obviously caseworkers are essential, and I'm they're doing the job because they want to protect children. But I'm wondering, how do we, is there any assessment that you know of where the department will look at how a caseworker is doing by following back and following up on that caseworker and their thoroughness with the people that are in the community?
So I don't know the answers to how specifically supervisors are supervising the caseworkers. That's not something that I see. But I think in general, again, I think if an assessment or a case is done thoroughly and all of the information is followed up on, I think generally speaking, collateral witnesses like school teachers feel like they've been heard and feel like their concerns are being taken seriously. But I don't know exactly what is done in supervision that follows up with those types of things.
Yeah, so I think it's an important point to consider, because as I listened, if people making reports and are seeing concerns in children aren't hearing back from the department, which is what I heard, that lack of communication, I think it's easy to see how children could drop through the cracks there when the people making a report have no idea. They just sort of drop the information into a black hole. If they don't hear back, they don't know, do I annoy someone and keep reaching out? Do I assume they've taken care of it? And so that was concerning to me in some of the stuff I heard. And then one of the other things in your letter to us today that I appreciated was the idea of the qualitative measures, because even today when I asked about where are the children, is there a safe place for the children to go? And it was mentioned that the hoteling has dropped, right? And so the number of children that are being housed in a hotel has dropped significantly. But that, of course, is not a good measurement on its own if those children are not then put in someplace safe, right? So it's good that they're not in a hotel, but not good if they're not in a hotel because they were left in an unsafe location. And so I just wanted to ask you the same question that I asked Dr. Landry, and that is, are you aware of there not being enough placements or safe locations for us to move children, and whether or not that's affecting the timeliness of children being removed when they should be?
So I have not actually seen that particular issue in a case, at least that it was that clear and that obvious. I think it's been a difficulty for a long time that we don't have as many foster homes as we would like. It's one thing for children to be able to go to a safe foster home, but ideally we should have an array of foster homes to choose from so that child can be placed in a home that is best suited to their needs for whatever reason. I think we particularly struggle to place older youth. That is one thing that I see a lot. We struggle to place older youth in foster homes, particularly youth of all ages that have behavioral difficulties. there is certainly, we could definitely use a lot more therapeutic foster homes. And there are certainly cases where children get placed out of district and, and there are searches by placement specialists that go all over the state and they can't find anyone. I think it's a difficult problem to solve because the amazing foster parents that do those types of cases are hard to find. It's not something that everybody can do. And I know that there have been recruitment efforts, but I would say that it is certainly an issue. And I believe I have no reason not to believe that the hoteling issue has gotten less. I actually haven't seen that in a while, so that's probably true, but it's still an issue that's going to affect children not having enough foster homes for sure.
Okay. Thank you.
Representative McDonald.
Thank you, Chair. You may not be the appropriate person to ask this question of, but I was hoping that you could shed some light on the serious injury and death review process. So they, I assume, make recommendations, issue reports. Where do those reports and recommendations go? Do you have access to them? Do I have access to them? If you could tell me a little bit about
Sure,
that process, that would
sure.
be great. Thank you.
So I don't know a lot about it, but so they basically they review cases, and as you heard, they review them after if there is a criminal process involved, they review after the criminal case is over. In the past, they have issued public reports that, for example, many years ago, maybe 2016, 15 now, they issued a report that detailed that SIDS, or death of infants for no apparent reason, was a serious issue in Maine. And in fact, more babies were dying of that than anything else. So that's the kind of information that they can collect, put in their public report. And that actually resulted in some changes in the department in terms of how they were making sure that babies were going to sleep safely. So that is, that's been my experience with them. I don't believe that, I'm not sure exactly what happened. There was a long time when they didn't issue a report. It would certainly be something that would be valuable to look into, I think, because I think they have a lot to add. They have doctors and, experts of all kinds on that panel. And again, I think, and I believe that the statute at this time says that they have to wait until after the criminal cases are over, but I don't know if that could be changed either. So they certainly could provide a lot of value, but I'm not sure when their last public reporting has been.
Thank you for that answer. Thank you for that information. And just to share with everyone, my regrets that I do have to leave. My own 3-year-old that I had here earlier has a medical appointment, but I strongly support moving forward with further action from GOC. Thank you.
Thank you, Representative McDonald. Further questions or comments from Ms. Alberry? Representative Stover.
Thank you, Ms. Alberry. Nice to see you again. I appreciate your memo and the level of detail and I will say succinctness, because I think you've just really honed in on some specific things. And one of those things that you seem, the theme within is about accurate risk assessment at different periods of time. And I'm just wondering, and not necessarily to the specific tool, I'm saying in general, if you can speak to any specific ways or any specific areas of improvement you would see, whether that's qualitative measures, which I do agree with you, qualitative measures are really great. But are there any specific things you would want us, you would recommend about risk assessment at any period during a case that would speak to some of the concerns you've outlined here?
So in terms of, I'm sorry, are you asking in terms of recommendations for what the committee can do, or just more knowledge about what the?
I think at this point, just knowledge about the
Okay.
process of risk assessment and
Okay.
where you see
Sure.
some of the concerns you've mentioned around risk assessment.
Sure. So risk assessment. So there, as you heard Dr. Landry mention, there are the SDM tools, which are the structured decision-making tools, which are one way of measuring risk assessment. And actually there is this SDM tools are really great tools. The issue is that taking the SDM tool, if there's a vacuum of other information, sometimes the information that's put into the SDM tool is not sufficient for the SDM tool to spit out an accurate number. In terms of what the types of things that happen for, I know you had asked about reunification cases. The things that a caseworker or supervisor need to look at during a case to decide whether or not a child, and in the cases, where you're talking about reunification, should this child go home anytime soon? The questions are much less about the child, although that is certainly part of it, especially if the child has significant needs of some kind. The question is really about the parents. How are the parents doing? What was going on in this parent's life when the child entered custody? What types of services does this parent need in order to address the issues that they have? I mean, a really common case is you'll have a parent who is a victim or a perpetrator of domestic violence, who has substance use issues, underlying mental health issues, and then oftentimes criminal histories, and many times has their own history as a child in child welfare. So all of those things you have to address. You have to address their trauma, impulse control issues. If they do have an official mental health diagnosis, that needs to be treated. Their parenting skills maybe need to be addressed. And so all of that, it's important from the very first day that child enters custody, or the very first contact that the caseworker makes with that parent, that as fast as possible, there's an investigation into what is going on with that parent. Will that parent be able to participate in treatment? Is that parent participating? Is the department sending the parent for random drug screens? Is the department talking to the parent's therapist regularly about issues that came up in the last family team meeting where the parent lost their temper and stormed out? Is the parent getting the correct level of substance use treatment? And all of that, it's a difficult task, because ultimately, no matter how much information you have, you never quite know what's going on with the parent. But some of it is face-to-face visits with parents, getting to know them, seeing how they're doing. So it's a combination of social work, helping a parent, really trying to, make them be able to make the changes in their life, while also investigating them, sending them for, random drug screens and doing unannounced visits to their home to sort of try and catch them if they're not doing well. So it's an odd combination of things for a social worker to do, and there are many that do it really well. And so without all of that information and gathered consistently, because none of these changes happen overnight, it's hard to tell at the end of the case what to do sometimes. And sometimes it ends up being an evidentiary issue in court. So for example, if you don't have those random drug screens, if you don't have contact with the parent's therapist, if you never followed up on that psychological evaluation that said they needed this other kind of trauma therapy, then there's nothing to give to the judge, even though that parent isn't safe because you've known them for a while and you're pretty sure they're not doing well. How do you prove to the court that child should not, in fact, go home? So it's a really complicated process, and I've tried to speed through it quickly, but those are the types of things that a caseworker uses to assess the risk in a family as time goes on in the case.
Thank you. You answered my question.
Further questions or comments for Ms. Alberry? Senator Kime. Oh, I'm sorry, Senator Kime, if you could just pause for a moment. I introduced Senator Bennett earlier this morning. He had audio issues. Senator Bennett, if you'd like to introduce yourself now.
Thank you very much. Sorry, I had to attend another meeting too in between. I am Rick Bennett. I have the honor of representing 13 towns in Oxford and Cumberland counties in Western Maine and the beautiful foothills and lakes region. Glad to be with you today. Thank you.
Thank you, Senator Bennett. Senator Kime, please proceed.
Thank you. Just one other question as I'm listening to you and recognizing how much faith and how much we need your position in our state. Is there anything that you would say hinders your ability to do your job or to be more effective?
I think there are a couple of things that I think could make the ombudsman's office more effective. Back in 2019, I believe it was, we submitted proposed legislation that would strengthen the ombudsman's office. And I think, a lot of those things still hold true. I think there are two things that I think would do the most. One is to increase our staff. I was fortunate to be able to hire our new associate ombudsman, Ashley McAllister, about 3 months before the pandemic hit. So that was interesting. But she used to be a department caseworker, and she's a social worker, a master's in social work, and she has added enormous value to our process and to our organization. We could still use some more staff. I don't think that we are, particularly in terms of our services to families. I wish that we could do more. I wish we could talk to more people and, provide more information and referral calls and and give families more discussion and closure about our reports. So we could definitely use more staff. The other thing that was in our proposed legislation from then is that right now, our program is, we just have a normal contract with the Department of Administrative and Financial Services. It comes up for renewal. I think it would increase our independence from the government if if the ombudsman was appointed for a term, just as the director of OPEGA is appointed, or a number of other types of organizations. The rest of the ombudsman offices in New England, aside from New Hampshire, are actually called child advocates, and they're all appointed for terms. So it's those are the two main things. I still have the legislation, obviously, and I can show it to anyone who would like to see it. But those are two things that I think would help us significantly.
Okay, thank you.
Senator Bailey.
Thank you, Mr. Chair. So I have a real simple question. In reviewing your report, one of the categories when you're compiling numbers about your different cases, one of the categories is action cannot be undone.
Sure.
Can you give me an example of what you're talking about there?
Yes.
Thank you.
So it's something that, say in April, there was a child who was left unsafe in the home by a department investigation, not removed from the home for 3 more months. And then eventually a new assessment came in or something else happened, and the child was removed and was now in state custody. The issue in that report would be the fact that that child should have actually been removed 4 months ago, and was in the home for that period of time that was unsafe. But we can't undo that now. The child's safe now, but we can't go back in time. But that's still something, if it's within my reporting period, that I'm going to note as a practice issue of the department.
Further questions or comments? A couple of brief questions or comments from me, Ms. Alberry. In the beginning of your testimony, I want to make sure I understand this correctly. You noted that you are independently reviewing 3 of the deaths out of the 4 that we were talking about. So I understand that there are disclosure issues, but should I interpret that to mean that 3 of the 4 cases we're discussing had Child Protective Services involvement?
So I don't think I could tell you, but I don't know yet, to tell you the truth. I don't have any of the information at this point.
Okay. Is that typical in this process?
So I just did my normal process, and I think I'm probably just coming up on the deadline now when the department would respond to me.
Okay. My second point is more of a comment for OPEGA staff. Ms. Alberry noted in her testimony near the bottom of the page, they completed a review of 43 child welfare cases. Out of the 43, 17 had substantial issues, practice issues, equating to 40% of the cases. So in our follow-up work on this subject, I hope we can zero in on some of the details, understanding there's case details we may not have access to, but if there are themes or patterns that come about, I think we'd be interested in digging into that more. Seeing no further comments or questions, Ms. Ellery, thank you for spending time with us this morning.
Thank you.
Next on our agenda, we have had 2 requests come in from members of the legislature for us to conduct some form of investigation on this matter. I noted at the beginning, we'll hear first from the Senator from Waldo, Senator Curry, followed by the Senator from Cumberland, Senator Diamond. So welcome Senator Curry this morning.
Senator Libby and distinguished colleagues of the Government Oversight Committee, thank you for having me. My name is Chip Curry. I'm honored to serve as the state senator for Senate District 11, which comprises Stockton Springs and the 25 other rural, coastal, and island communities of Waldo County. I present today to you on behalf of Maddox Williams, Kendall Chick, Marissa Kennedy, and unfortunately too many other children who have lost their lives here in Maine. The death of any child is always tragic, especially when it could have been prevented. The Department of Health and Human Services, Office of Child and Family Services, and Child Protective Services has failed these children. We all have failed these children. We said this after the death of Marissa Kennedy, when support staff, caseworkers, and other adults in her life failed to intervene before she was killed from years of physical abuse. We said this after the death of Kendall Chick, when a thorough assessment and monitoring of her placement could have changed the course of her life. Now we say this again after the tragic and preventable death of Maddox Williams. There is no excuse for our failure to act on child welfare reform. The deaths of Maddox Williams, along with 3 other children in the last month, prove that our actions have not been sufficient. Please don't misinterpret my statements as seeking an easy scapegoat or a simple answer to these tragedies. I know many dedicated public servants who work for OCFS at various levels, and they have my great respect. I also know that there are youth alive and healthy today because of their care, commitment, and professionalism of OCFS staff. But we have a problem. The Maine Child Welfare Services Ombudsman, as you just heard, did substantial work to point out the flaws and holes in our system, and yet few of the recommendations have been implemented. Despite changes in policies and the implementation of the new tools that we've heard about, the Ombudsman reports many of the same basic investigatory and monitoring issues remain. Poor support practices, especially in the first month of an investigation, can leave children defenseless for months or years. I'm deeply concerned as to why and what barriers exist that prevent achieving the systemic goals outlined by the Ombudsman's report. If the knowledge and information on how to reform our department and our systems exists, what is keeping us from succeeding, and where do we need to make further changes? Since making my requests to this committee, I've heard from anonymous current and former staff who reported toxic work culture, where child safety is in direct competition to meeting deadlines. I've heard stories where overloaded staff feel pressured to rush investigations for fear of poor performance evaluations. Now, I don't know if these experiences are rare or pervasive throughout the agency, but if these dynamics are preventing us from effectively protecting children, we need to find out. So I ask the Government Oversight Committee to work with the Ombudsman to investigate and identify the barriers to organizational change and possible strategies for overcoming them so as to build a more effective child welfare system. I have a second ask. I ask our legislator has a responsibility to all the residents of Maine. We need to be more effective in doing our job, which is providing oversight and ensuring the implementation of these reforms. Therefore, I also ask the Government Oversight Committee to investigate more effective ways our legislature can provide ongoing oversight and monitoring. I understand that the Department of Health and Human Services has brought in GOC Family Services who will be providing recommendations as well. And I request that the independent investigator work along with the legislature so that work can be transparent and lead to real solutions. Inaction will continue to cost Maine children their futures. Thank you for your time and consideration on this matter.
Senator Curry, thank you for your presentation this morning and your letter. Questions or comments at this time for Senator Curry? I think our process, Senator Curry, we'll hear from Senator Diamond in a moment, and then I think we'll hear from the OPEGA staff on what potential next steps we can take, but hope that some of what you're suggesting here can be incorporated in our next step as we investigate these issues. Thank you.
Thank you.
Good afternoon, Senator Diamond.
Good afternoon, Senator Libby and members of the Government Oversight Committee. My name is Bill Diamond, and I live in Wyndham, and I represent Senate District 26. I want to extend my sincerest thanks to you for today's hearing, for allowing me to speak, and also for the future investigation, which I'm hopeful you'll decide to take on. The prestige of this committee, the uniqueness of the committee, the total bipartisan makeup, the experience and seniority this committee carries, the uniqueness you have of subpoenaing when you think that needs to happen. And maybe the biggest and foremost advantage you have is that as a legislature, we go home in April or June, depending on the year. You don't go home. And that's the beauty of that, is that you'll be able to continue to monitor and continue to speak and investigate and do all that you need to do. I want to also suggest, Mr. Chairman, with your approval, that my testimony, as you see, is divided into sections. There's so much to say, and I can't do it all today, and I will be brief as possible, but I would encourage you, if it's okay with you, Mr. Chairman, to ask questions at the end of each section, because they do kind of become somewhat different as we go through it. So I welcome that, and also at the end. I want to say up front that I am not an expert in child protection services, but I am a persistent learner about child protection, especially those children in state care. For what seems like a lifetime, and I don't know how this started, I've watched OCFS move too slowly and then stall and even regress over the past 20 years. Understand this is through 4 administrations, an independent, Republican, and Democrat. My frustrations are knowing full well that under the practices that don't seem to change, there will be more child deaths that could have been prevented. Because of the 4 June deaths, the department now is contracting with Casey Family Programs, as we've heard from Seattle, to help analyze the problems. And I heard this morning that they're expecting some solutions within 90 days. That's all good news. I don't see that as bad. However, why the wait? Why have we waited? Is it because we had these 4 deaths, these children die, that we now have to reach out and be more demonstrative in our reaction? I'm just wondering why this didn't happen before. My goal is for the department and for the office to simply admit the system is broken. That's all I'm asking. And once that happens, you all and all of us can work together to fix it. That, to me, is the first big step. As instead of what we've seen in the past, withdrawals, being suspect of the people who are asking questions or presenting legislation. If there are any questions on that short piece, then obviously I'd be happy to take them. I will do a child deaths 20-year timeline because this does set up a trend. We go back to 2001 when I first got involved, and 5-year-old Logan Marr dies in her foster parents' basement. And we all heard those gruesome details, duct taped, put in the basement, to let scream, as the quote from her was. She was convicted of manslaughter and served 17 years in prison. But after that, the HHS at the time said, this is terrible, we're going to fix this. And we all welcomed those words. The fix tended to be that in 2004, they combined the Department of Human Services with the Department of Behavioral and Developmental Services, in effect, doubling the size of that bureaucracy, and possibly and probably even further losing sight of the Child Protective Services, dropping further into the bowels of the state's largest bureaucracy. Children in state care keep dying. A report 2017 indicated that at least 22 children died while in state care. The inconsistency of changing policies based on whatever the details were of the most recent death has been a consistent problem. For example, reunification. Logan Marr died not having been placed not with a family member, but with a foster parent. And by the way, the foster parent had worked for years as a caseworker in the department, which made it more difficult when when she was actually talked about how they were hurting her at home, and the supervisor at the time refused to investigate any further. I think that, by the way, those interviews were videoed because the mother was given permission to see and visit with her daughter. So these kinds of reactions then spurred, look, we need to reunify now. We can't be putting kids back in foster care as much as we can or should with a family member. Then in 2017, Kendall Chick, 4 years old, was placed with a family member, the grandfather. The grandfather, his girlfriend, beat, her name is Shauna Gatto, was convicted of deprived indifference murder, sentenced to 50 years in prison for murdering little Kendall Chick. The protocol violations in that, which I heard, which we all heard at the trial, which I attended that trial, were absolutely repulsive to see the lack of coverage of that little girl. She was beaten so badly at one point, they testified that she was thrown against a wall so hard her head imprinted the wall, and they found her hair follicles there. But she was beaten at a long period of time, but was not visited, maybe but once, was a testimony. Maybe one more visit would have seen what she was going through and how bad her environment was. That was in December. And in February of 2018, Marissa Kennedy, of course, died. She was 10 years old. Her stepfather, Julio Carrillo, and her mother, Sharon Carrillo, beat her to death over several months. Both were convicted of depraved indifference murder. Julio was sentenced to 55 years, and the mother, Sharon, was sentenced to 48 years. System there, too, totally broke down. I talked with, when they lived in Bangor, I followed back when they were living there, and I talked with the school principal where she went to school. And the breakdown of the system between what the school was reporting to the department, what the police were being called to, what the neighbors were complaining about, all the horrific noises coming out of that apartment. There were horrific noises because she would be placed on her knees, raise her hands, and then be beaten. In both cases, HHS at the time said, we're going to fix this problem. We're going to fix it because it's just terrible. In fact, Governor LePage came before this committee, which I was serving on. I've served on this committee, I think, around 8 or 10 years. I'm not sure what. But he came before it and said, we need to lower the caseloads, which he was right. And we need to go further. I mean, he was going to hire, proposed hiring 70 new caseworkers. And that was a legitimate reaction to a legitimate concern that he and the administration had. However, what we've learned over the years is hiring caseworkers is not necessarily the problem. True, we need to lower the caseloads, and that's going to mean more people, but to simply hire more caseworkers, throw them in there and say, now go for it. As you heard earlier today, it takes time. And I've talked to so many caseworkers, individually and in groups, who have said they really need mentoring. They really need ongoing training. The supervisors need the same. So it's a system change. It's a culture change that's needed, not necessarily just adding more cases. We added 15 more this year in this budget, which you have to applaud, but we have to understand there's a lot more that goes with that. And on June 1st, 2021, a six-week-old baby dies of shaken baby syndrome. Father Ronald Harding charged with manslaughter. June 6th, 2021, 3-year-old Haley Ann Godding dies. Mother Hillary Godding charged with manslaughter. In June 2021, 3-year-old Maddox Williams dies. Mother Jessica Williams charged with murder. From the initial public reports, it appears that OCFS did have some involvement with the Maddox in terms of young Maddox in terms of placement. We must wait to see if that's all true and see if they were involved in the other 2 cases as well. One of the glaring problems that the OCFS continues to have is the inability to assess when a child is in danger at home, which is reported, as you heard earlier, by the ombudsman. 2 major critical areas. One, should the child be put back in that home? Assessing that, and should 2, the child is already placed, should that child stay there? Obviously, there's been some serious failures in those areas. Mr. Chairman, shall I go on, or you just? The Maine Child Welfare Services ombudsman, as you know, is doing a fantastic job. It was created by statute, as we heard, independent and neutral. And her job is to do a number of things, including overseeing the child welfare policies at OCFS. The annual reports, which you've heard about, including the most recent one, specifically talks about those issues that I mentioned earlier. These 2 problems that have been existing for a long time are exactly what happened to Kendall Chick and Marissa Kennedy. And also Maddox Williams case could be a further prime example of when a child should not be reunited and put in a known unsafe situation. I think in that case, in public reports, if they had knocked on the door of a neighbor, they might have gotten a different perspective from what neighbors have told me. It's very frustrating when the ombudsman clearly tells OCFS where the problems exist, and then nothing changes, and still kids are being placed in dangerous situations and too many times dying. You heard about one of the changes the ombudsman would make, and that is her contract. I think it should be appointed. Clearly, right now, her contract or the contract of the ombudsman is signed by DAFs. But the way it goes, as I've learned, is that DAFs pretty much ask DHHS, do you approve? And I think a much more independent status would be having these people be appointed for a certain period of time. OCFS continual resistance of meaningful change and transparency has been an ongoing problem. In 2019, I submitted a bill, LD 1554, to establish a commission to reform child protective services. Now that commission, that was opposed by the department and it failed, but that they did agree to allow the public to have input, which you heard earlier, around the various regions of the state. But that is getting information in, as opposed to let somebody come in and look at what's going on. There's a big difference. This session, they also opposed my bill 1263, which would have separated that OCFS and make it into an independent cabinet agency of its own. The ombudsman testified in favor of the bill, as did the Maine Association for the Education of Young Children. OCFS and DHS, of course, opposed the bill with the committee pretty hard, and the committee voted 12-1 not to pass. Yet the Senate, surprising everybody, including me, voted 22-12 to pass that bill. But when it got to the Senate, when it got down to the House, of course, it couldn't withstand the objections that were being placed by the department. When the June child deaths became public, I asked the ombudsman to look into those cases, which is protocol, and see if OCFS was involved with the children prior to their deaths. The law specifically allows the ombudsman to see such information, yet keep it confidential. She got back to me and said that upon initial request, the OCFS refused to give the information to her. She reminded the director that the law was clear and he must share the information, which he finally did. One more case of a questionable obstruction, and the question is why? The ombudsman is a perfect partner for this process, perfect partner. There's no reason why they can't be involved. There's no reason why they wouldn't take them and say, look, what can we do? How can we make this better? More facts will be coming on the tragic June deaths. Other than the Williams case, the question remains, did OCFS have any involvement with those children prior to their deaths? OCFS knows that answer. The rest of us will soon. The change, one significant change we heard at the end of the kids with the June deaths, we didn't hear we'll fix the problem. Instead, we heard a new pledge that these deaths demand a call to action. As a result of my bill 1263, the accompanying publicity from that, from people around the state were contacting me from all backgrounds and all experiences. It wasn't because it was me, it was because of name. This information was pent up, the frustration, the fear, and they wanted to share that. My name just happened to be there. I heard from OCFS caseworkers, current and former supervisors. By the way, these emails and contacts are here. I've saved them all, hoping at some point you will be able to look at them if these people agree. Former supervisors, frustrated foster care parents, and the Maine's Child Death and Serious Injury Review Panel. And believe me, they have some frustrations as well. A former Assistant Attorney General who worked at DHS. And I think that person is going to be willing to talk to you if you request. Some of these stories these people are telling us are chilling. And you wonder, how could this go on? As I mentioned, there are people who, most of the folks in that folder do not want to have their names released because of fear of retaliation, either as a foster parent or retaliation and losing their job. Others have offered to do that. For as long as I've been working on child protection issues, I've never experienced this kind of outpouring from the public, the media, and those associated with DHHS and OCFS. This bodes well for the potential for significant changes, and perhaps for the first time, we can redefine that office. We could actually guarantee success if the department, and specifically OCFS, would simply admit that their system is broken. Instead of making excuses and saying, we're all going to do this, it's going to work out fine, we're moving ahead well, nothing to see here. Then and only then, if we work together instead of working apart, can we make a big difference. In closing, Mr. Chairman and members of the committee, I don't think anyone here would disagree with the fact that as we sit here right now, there are children in state care who are being abused in horrific ways. Sadly, we won't know their names until they die. And then it's too late for a call to action for them. Thank you for allowing me to share with you some of my thoughts, and I'd be happy to answer any questions.
Thank you, Senator Diamond, for your presentation. Are there questions or comments for Senator Diamond from the committee? Representative Millett.
Thank you, Mr. Chair. Thank you, Senator. You've been involved with this for a long time. Obviously, the 20-year continuum illustrates that the problem hasn't been fixed yet by a long shot, and it calls to action, if not followed through with specific outcomes, really fail to address the issue that you've been speaking out on for many years. I guess what I'd like to know, Bill, is from what you now have heard today, the commitment to involve a reputable group to look at this in a 90-day frame which has a reputation for being exemplary in their safely reducing the needs for foster care, which to me doesn't get into that four walls of the home where the beating is occurring. And with the ombudsman and OPEGA's involvement, I wanted to get a sense of your feeling, and Senator Curry's as well. Are these steps which are going to gather input from stakeholders, look at training, look at policies and procedures, look at resources, all of which fall in the input equation for me? If they don't come out with hard recommendations, which are outcome measurable, that will fix the problem, do we have the right game plan in front of us? Because I know you spoke about the importance of rectifying previously identified shortcomings. Senator Curry talks about barriers to organizational change. All of that reminds me that we know we've got a problem. Your evidence proves it, and time has verified it over and over. Are we on the right track, or do we need more of an action plan rather than a gathering of feedback and input? And are we fulfilling our role as a legislative oversight agency if we don't toughen up, that's my word, the plan that's emerging before us today? I guess I'd just be interested in your thoughts as to, are we headed down the right path, or is it a rabbit path that's not going to fix the problem?
I don't think it'll fix the problem if we continue on the way we are. And if we simply say, here's another well-respected agency that's going to come in and take a peek at, take a look at, do some analyzing, and come up with an answer. I think their information that they will come up with will be helpful. But for me, this committee, above all else and all other committees, needs to make sure that we don't just do a frontline survey as we did in 2018. That was helpful. And by the way, talked with a lot of people who participated in that, not a lot, some, who were still afraid to give honest answers because they didn't trust the fact that would not somehow get back to their bosses or their superiors. But I think that the only way to address this, Representative Millett, is for this committee to find a way with OPEGA to take that system apart, look at it piece by piece, which would include surveying, of course, but it really take a hard look, dismantle and take a hard look, and maybe Casey could be really a good part of this. I think we're wasting a little bit of potential from Casey if we simply had them come in. The department directs them on, here's what we'd like to have you do, and they go do it. I think we ought to take advantage of them coming and really take this place, take it apart. 90 days. I mean, I don't know why 90 days. You and I both know, we all know that solving a problem that I've been aware of for 20 years is not going to be solved in 90 days. But let's take advantage of those people, that expertise, and let's take that whole OCFS apart piece by piece and then rebuild it. We have to analyze the policies and procedures. Why are they putting kids back into homes that are safe? Why did Maddox Williams go back into that home? And what the more facts and what we know now, none of us would ever do that. So we have a tremendous opportunity here, which is why I said initially, thank you for doing this. We have a tremendous opportunity to really make a difference. We can really define that office. And I want them to know that this is not pointed at any individual, any commissioner, any governor. I'm saying let's work together, and we can't work together unless we're willing to say, you know what? This is more than a flat tire. We've blown an engine, and we've got to really take a look at this. So that's my direct answer, Representative Millett. I think Casey coming is good, but we cannot just sit back and let that report come in and we look at that and it's going to make us feel like, oh yeah, we're going to change this, that, and whatever. And we end up with really not a transparent operation.
Yes, please.
Thank you, Mr. Chair. Just a quick follow-up. I may be getting ahead of the last bullet under the new business item, which I'm sure you will steer us toward and get us focused on. I feel a need for a stronger legislative imprint on the plan that's approved here today or subsequently than simply accepting what's actually ongoing at the moment. Because it feels to me that we need to be accountable to our own constituents, but to the people in the executive branch that we are in oversight relationship to. And until we get an answer to the question you posed a while back, the basic question, what went wrong? Then we're only enabling a process without accepting personal and committee accountability. So I'm hoping that as we finish our work today and you get us focused on that question pending in new business, that we actually give it a little bit more of a push than simply saying, yeah, go to it. I want to be actually active. Thank you.
Further questions or comments for Senator Diamond from the committee at this time? Senator Bailey.
Thank you, Mr. Chair, and thank you, Senator Diamond, for working on this issue for so many years. So what I'm sort of taking away are three broad themes, and I just want you to let me know if there are others. So the three that I picked up on are transparency, accountability, and oversight. Are there any that you would add to that list?
I think the functionality within that office, because I think it's several layers deep, and I think there's some culture issues, not just with this current administration, but it's been that way. And so I think if there can be a detailed analysis, and this might fall in some of that three you just mentioned, but to focus on that piece to make sure that there's a clear understanding of how it actually operates. And that doesn't require confidentiality. Truly it does when we're talking about individual cases, but there's no reason why we can't find out exactly what they do and how they do it, and double check and get some accountability on those answers.
Thank you.
Further questions or comments? Senator Kine.
Thank you. Thank you for being here, Senator Diamond. You touched a little bit on what I was going to ask you, but I'll just ask you to further expound on it if you would. But part of the frustration I feel as we listen is that there are a lot of walls up because of protection of the privacy issues around the children and the situations. And so it seems that the questions that we would want to ask that would maybe help us really dig down, we can't ask or we can't get answers to because of confidentiality issues. So I just wonder if you could just talk a little bit further about that and what you see further our role being and how to dig in, even though we have that as a hampering our abilities.
You know, one of the things that I learned sitting through those three trials, Aurelio, Sharon, and Gatto, was all the things that actually happen within the Office of Child and Family Services. And it's not like television where you watch it for an hour and all of a sudden there's a Perry Mason ending. Sorry for somebody's too young, but that doesn't happen. So I think there's all the information that can come out at that point, albeit late, can and should be utilized in restructuring. Now, we could go back as far as Logan Marr and see what happened there, compare it with in 17, some things that happened, some deaths that was tragic deaths of little kids. And we can, I know it's already been done, but we can do a different approach maybe to Marissa and Kendall. There's a lot of information there. And when you get in the Kendall Chick case where a caseworker testified that she visited once in 6 months, I think we can look at that and say, why? Was she doing what was expected? Was she unable to get there because of other reasons? So I think there's a lot of assumptions we can't make, but there's ways of getting to that information. I'm confident and in the process of assessing and really, as I said, dismantling a system that I don't think we can patch it up. And I think the information is there, especially the policies and practices and see how they've been applied to some of these tragedies, or weren't applied. I'm not sure if I answered that, but I tend to ramble a bit on that one.
Thank you. Yes, no, that was helpful.
Senator DeChambeau.
This is difficult for me. Difficult in that I am a caseworker, have been, and have worked with the people who ended up in prison committing these crimes. But first, I'm a caseworker. That was my life. That's in my soul. I worked for a state facility institution. I bring this to light because someone said, and I think it was the ombudsman said, frontline staff need to have their voices heard. That will never happen. And maybe because what Representative Curry said too, it is a toxic environment. And we're just not talking about DHS. Caseworkers in the state of Maine or any state, you either work for a state department, it could be Riverview, it could be Dorothea Dix, you're a caseworker there, you're a caseworker in any behavioral health umbrella institution and in prisons. When they say have their voices heard, I was saying what? In development of policies, again, that won't happen. But they need to be heard in an environment where leaders, commissioners, or what have you, maybe even anonymously, for those people who work there, what is the barrier for them to do their job well? I think the ombudsman touched upon it in, I believe it was her testimony. And I would say she touched upon it in that the powers that be who run big institutions, and it's not only, again, the state or the government. Outside private hospitals have caseworkers, recovery areas have caseworkers, nursing homes have caseworkers. So the powers that be, they really protect their environment. They don't want to let out a lot of information. But the ombudsman said some of the frustrations on how to do a big, and I agree with you, the Department of Health and Human Services is too large. That what you do is you measure it quantitatively and numerically. There's nothing worse for a caseworker to be told to put the numbers in and not be able to do good case management one-on-one, because the only thing that matters is the sheet that says quantitatively, qualitatively, numerically, what it is you're doing. So there's a divorce from that. And I'll just end because I could go on all day on that one. But I truly am appreciative of what Representative Mellott said. I agree with you. It is time to have something a little more solid. When I heard Casey family, and I've heard of them, I've heard good things. And what they do is they come in with other states. Well, how many times have we been on these committees and we say, this is not Maine. You're bringing me something from New Mexico, that this is not what we're doing. So we need something a little bit more than that. And I agree with you, the people who are in charge, it is much easier, and the Department of Corrections just went through this, to say, well, we had these national experts tell us this, and it collects dust. And we don't want it to collect dust anymore. So I am in full support of what you recommended, Representative Miller, and I think we need to do that. So thank you for hearing me out.
I think you're right about frontline workers' voices not being heard, but your voices will be heard. That's the big difference.
Further questions or comments for Senator Dunn? Senator Diamond, thank you for your presentation this morning and for assisting us in this project. We understand you have some materials that at the right moment may be able to be shared with OPEGA staff. I think we would welcome that. and
I'm
would follow
clearing,
your
I've already
lead.
cleared some of these for you to have, and some of them I think would be very, very helpful for you.
Thank you. Thank you. We're joined now by Lucia Nixon, Director of the Office of OPEGA. Lucia, I think what we're interested in, we've heard a lot of information this morning. We have two requests made by lawmakers for us to engage in investigation of OCFS. I think what I'm hoping we can come out of today's meeting with is a motion to direct OPEGA to do work, to begin work immediately on fleshing out a scope of work for this project. And that we give OPEGA staff time to develop that scope based on our input and bring it back to us for the August 11th meeting to finalize and take a formal vote on. But I do think it's important for us, and I believe we're heading in this direction, to direct OPEGA to begin this work immediately. So with that, I think for context and what we could take for actions, I'd like to turn it over to you, Lucia, to help
Sure.
walk us through that.
Great, thanks. So as Senator Libby said, you have been presented with two requests. So in addition to the testimony that you heard this morning, you have the letters that were submitted by Senator Curry and Senator Diamond making the request for an OPEGA review, and also an OPEGA one-page summary of the review requests. And I would just note that the possible topics or scope areas that were highlighted in those two requests. So when they made them in writing to you in the past week, Senator Diamond, one point we pulled out was evaluating agency policies and practices around assessing and ensuring child safety in the home, and evaluating this agency's actions to address systemic shortcomings in protecting children that have been identified by the ombudsman. And in Senator Curry's request, there was to understand barriers to successful implementation of the recommendations. Again, those recommendations from the ombudsman to address shortcomings. So questions about why, what are the barriers to implementation? And then this question of how the legislature can provide more effective oversight and ensure the implementation of reforms. To put this in the context, as has been mentioned a couple of times today, the OPEGA and the GOC have been working on these issues for a number of years. Obviously, as Senator Diamond suggested, they go back much further than that. But I just want to, as you think about your next steps, just quickly review what OPEGA and the GOC have done in the last 2 years, 2 to 3 years. So in 2018 was the first recent piece of work for OPEGA. The GOC directed OPEGA to conduct a case study of how the Child Protective Services system functioned in the 2 cases of child death by abuse in the state at that time. So that was Kendall Chick and Marissa Kennedy. And OPEGA issued an information brief in May 2018. You all have received copies of that. Following on that, the GOC directed OPEGA to collect and analyze data on the factors that impact efficiency and effectiveness of frontline workers. And for that, OPEGA conducted a survey of all frontline workers, including both intake and assessment, and so several types of workers within and supervisors, and also did individual interviews with a subsample of all surveyed frontline workers. And that resulted in an OPEGA information brief in February 2019 that reported on the results of the survey. After receiving that, the GOC added two projects to the OPEGA work plan. One was a review of out-of-home placements for children removed from their homes by the state. And a second was to conduct at a later date a follow-up survey of the frontline workers to see to get a perspective on how things have changed or not and what emerging issues might be. And what happened over the past year and a half, I guess, is that OPEGA first just paused the out-of-home study and collected data. As Dr. Landry mentioned, they provided us monthly reports of metrics, again, quantitative metrics. And that was just sort of coming in over time, and we were monitoring that. And then this past March, we brought that back to the GOC in the context of setting up your new work plan, and talked about just the basic trends there. And it was decided at that time that it would be an opportune time for OPEGA to proceed with the second survey of the frontline workers as soon as our resources became available, which we were just coming up on that point now. So OPEGA, you know, irrespective of what has just happened in the past couple, you know, in the past month and this meeting, we were sort of poised to go out and do the follow-up frontline workers survey. That was the next up. It's on the work plan and for immediate action. And then the other piece on out-of-home placements, the decision of the GOC back in March was to wait and see what comes out of the frontline worker survey and decide if out-of-home placements was really where was the most fruitful area for additional work. So that sort of brings you up to where you are today. You have the follow-up survey of frontline workers is on the OPEGA work plan and is sort of teed up to be started very soon. And then you had sort of in the wings out-of-home placement, further work on that, should that continue to be an important topic. Then now before you today, you have these two new requests that have come about in light of the recent deaths of young children and an interest in taking some swift action and, you know, looking into maybe some other angles of what are the really pressing issues. As you've heard from, I think in various parts of the testimony today, there has been, again, this mention of frontline workers. And so, you know, consideration if that's where you would like OPEGA to proceed with that and see, shed some light, maybe get some new questions that emerge from the current concerns. And then obviously there's been significant attention to the issue of child safety, both at the point of the initial assessment and whether the child should stay in the home, and then also at the point of determining reunification. And then I think a third theme I've heard is about strategies to improve legislative oversight, as well as how the different entities and oversight bodies, including the Child Welfare Ombudsman and the review panels, the Serious Injury and Death Review Panel, and then also the Domestic Violence and Homicide Panel. So what are the roles of these different entities, and how can potentially, what are opportunities to strengthen their work in protecting children? I would comment then it's important as you think about what you want to direct OPEGA to do, that you think carefully about what gap can OPEGA fill that is not being done. So the department has Casey Family Services coming in, the ombudsman is doing her own review plus participating in the Casey Family Services work. What are the specific added value that OPEGA could bring to that? What are the tools that we have? What is our expertise? We are, as you well know, most adept at doing performance evaluations or reviews of how agencies are operating, where there are systemic problems. We can obviously do surveys, we can do case review, we can review data, you know, agency data, we can review case records from agencies, we can do interviews. So think about where we can add value to, or things that other people aren't doing, because there is a lot of work being done and we don't want to take, you know, our small resources to duplicate things that other people are doing. So I just wanted to sort of set the stage with that.
Thank you, Lucia. That's helpful context. So in terms of our next step here, I think what we're hoping to accomplish is a motion being made today to initiate an immediate review of OCFS with the contingency that we will have OPEGA staff come back to us on August 11th with our whole scope, all of our requests and the requests of the two members for us to finally define this project. So I think as a way to get us started on this process, just as a reminder, our listing of GOC actions is included in our packet. I'm not sure which tab it is on, but there are 6 options for us to take. I'm suggesting we ask OPEGA to initiate an immediate review and that this matter be placed on the work plan with final consideration of the scope of work at our August 11th meeting. Within that scope of work, I would suggest including the requests, the specific requests made by both legislative sponsors. And I think if folks are open to this process, we would now add our additional requests for information, get that all together in a list. We'll do our final review on August 11th. That process sounds like a good way to proceed. Then I think now would be the time for members to add to that list. Senator Bailey.
No, I was just going to make the motion.
Okay.
Did you want to form the motion?
Sure.
So moved.
Is there a motion made by Senator Bailey, seconded by Representative Stover? Committee discussion on the motion. Is that adequate for what we need to accomplish today, Representative Millett? Yep. Yes, Senator Bailey.
So I just wanted to make sure that encompassed in that was our direction for OPEGA to go forward with the survey of the frontline workers. I just want to make sure that that doesn't get lost in.
Yeah, I think we want to have that included in the scope. I think we may want to have discussion once we've had a little time to process this about how we'd like to shape that survey, given what we've heard today, we've heard in the last month. Certainly the survey will be an important tool in this work. I noted earlier to Lucia that the ombudsman had shared information regarding some 43 cases. I think some analysis of that is what I'm thinking it could be helpful in this work. I guess I'd also add Senator Diamond has suggested, well, he's brought to us a file of correspondence from folks he's heard from. I think we want to think through how we might gather data in a safe and confidential way to respect those folks, but figure out a way how to incorporate that feedback into our project. Are there other items we should add to this list? And understanding that committee members can communicate with staff in the interim to add additional items. Senator DeChambeau.
Regarding the survey, what would be your intent? How would that be conducted? Would it come from OPEGA and not from the department? Or what?
Yeah, maybe Lucia could speak to how the last survey was
Sure.
conducted. That might give
Yeah.
you.
So hopefully you have this, or I can get you another copy. There's the OPEGA report on the last, the survey that we did, and it was a survey of the full population of frontline workers, and it was done by OPEGA. OPEGA got, the list of all the workers and was issued by OPEGA and reported to OPEGA. It was administered by OPEGA. So we would follow that same process that we did. We got the sample of who to interview or who to survey we got from the department.
I'm sorry, I apologize. I did read that and I didn't put 2 and 2 together, but what was said today, I think we need more information. Thank you.
Sure.
Senator Khan.
Thank you. And I'm not sure how how to frame this as far as something for for OPEGA, but I'm concerned that we do some sort of review of the department. I think somewhat what Senator Curry mentioned about maybe whatever cultural issues or something is there, but just a survey of the frontline workers isn't enough. We need to figure out where is there a disconnect between, you know, what we're hearing in reports, which is here we are doing all of this and good changes are in place and, you know, we're on our way to making sure everything's running well. And yet, you know, we've heard, as Senator Diamond said, we've heard that same type of thing for years, and yet things aren't going well. And certainly, you know, what I heard from folks in my district, you know, points that there's a disconnect between what is being experienced and then maybe what's making it all the way up the chain in the department. So OPEGA is good at doing department reviews, but I'm not sure how to articulate this well, but we need to figure out how is there a disconnect between what we're being told, what maybe top level they think is happening and good changes are happening, but then it's not playing out.
Thank you, Senator. I think I understand what you're hoping to accomplish here. So for Lucia, in our 2018, 2019 reports, OPEGA did do some interview work with community service providers, schools, law enforcement, et cetera. Is that correct?
I would need to double check on the details of who was interviewed, but I think the type of work that Senator Keim is talking about is definitely in our wheelhouse, to interview not only staff within the agency at different levels, but also partners, community partners, and other parts of the system. That could certainly be part of the process to really tease out what's going on and where the disconnect is.
Senator Keim, is that something you want added to our scope?
Yes, I think so, unless someone has a way to further refine that. But yes, I think that is important.
Yeah. Additional comments? Representative Stover.
I just wanted to add, I'll try to find the document quickly. In the ombudsman's report, she had outlined of the three panels that when we talk about stakeholders, that there are three existing panels that analyze particularly whether it's sentinel events or deaths, and also serious injury. And I'm trying to put my finger on it, buried here somewhere. Here it is. Thank you. It was the Child Welfare Ombudsman, the Death, Serious Injury and Death Review Panel, and the main Child Welfare Advisory Panel. Those three panels be considered as stakeholders. And I would not, and we have a copy of the Domestic Abuse Homicide Review Panel, which I did participate in. It's an outstanding report. I wouldn't leave that out of the equation because there are crossover issues. I think if we can, as we think about stakeholders, include the work of these panels, because all of them have specific, every time they issue a report, they point to specific recommendations, and they're often systemic recommendations. So I would find a way that we pull the best from those those four different existing bodies who all have looked with different lenses at child welfare. Thank you.
That's a great point, Representative, and I think if Lucia's understanding that request, I think that should be incorporated in the scope as well.
Can I just repeat it back and see that I heard it? So part of what you would like OPEGA to look at or frame how we would look at would be understanding or gleaning from the work of those four independent or quasi-independent panels, what their role is, how they could work better together, what can we learn from them, that sorts of information.
Yes, exactly. Following the recommendation of the ombudsman, because it's a really good one.
Further comments, questions? Representative Millet, you had suggested earlier of trying to figure out a way for the legislature to have some oversight over the Casey project. Is the motion before us accomplishing that in your view, or are you seeking something in addition?
I think it's certainly on track, Senator, and thank you for your way of analyzing it. I just assume that, we are the legislative oversight agency over the executive branch, and this is an area of major concern, and we need not to walk away without having a plan that fulfills our duty and responsibility.
Sure. So Senator Bailey.
Just gonna hand you back to me, so I didn't think you'd see me. Thank you. I just wanted to address that further to Representative Millet. That's why I asked to see the actual request, because I think that that would give us committee members an opportunity to comment if, for example, we thought the request was lacking in some way, or but without actually seeing the request, I can't even comment on that. But I am hoping that will come to us soon, and certainly we would have an opportunity to address any concerns that that raises or not.
And I understand from Dr. Landry this morning that OPECA staff would be welcome at the work sessions for the Casey project. So I think that's another avenue for us to understand how that process unfolds. It's been a long morning. It's now the afternoon. We have a motion on the floor. Is there any further discussion? Folks ready for the question? I think we can do a show of hands. All those in favor? Unanimous of those present. All right. Finally, as a reminder, we will have our next meeting on August 11th. Lucia, is there any other housekeeping matter?
I would just mention that that is scheduled for August 11th, and that you, in addition to us bringing back what you've just asked us to bring back for a scope of work on this new set of research, that there's also going to be the public comment period for the Citizens Initiative and People's Veto process report that we presented at the last meeting. And also we're on schedule to do a presentation on the evaluation of the seed capital tax credit. So it'll be a full meeting, and we will need to decide relatively soon on the format and location of that, because we will involve, it will have the public process for that report. So we will get that, I'll work that out with the chairs and get back to everybody on the details of that soon.
Any other questions or comments from the committee? Seeing none, a motion to adjourn is in order. Moved by Senator DeChambeau, seconded by Senator Bailey. All those in favor? It's unanimous. Thank you.